5 o'clock. Thank both of you for being here tonight. We do appreciate y'all coming. This is an educational experience tonight, hopefully. Legal counsel will not be with us tonight, hopefully we don't need him, but has another meeting. And everybody got a copy of the agenda? Are there any announcements? Anybody?
Mr. Chairman, I think Mr. Stahl is running a few minutes late, so if we wanted to bump some health.
Oh, yeah. We'll just switch as long as we,
Go first with public health, and I'm texting some, I don't see Patrick here either. I just wonder if they might have thought that the meeting was at 6 p.m. and not 5.
well, about 30 minutes ago, I thought it was too.
Just glad you.
Okay, we will make an addition or a change on the agenda. We'll Macon County Public Health. Kathy, Melissa, welcome. What we're doing, we have nothing specific. There's no format to this. It was a request that we bring in some of the departments, just to have 2 new commissioners, not kicking them, but it gives an opportunity for them, the public, and the media, maybe to get a little grasp of what y'all do. And there's no way you're going to explain it in 5 minutes. We're not giving you 20 minutes, but once you make do you have a presentation?
Yeah.
Okay. And then after that, we'll, hopefully you'll entertain questions or comments. And,
How are you, Kathy? Thank you.
Oh, you got some that way too.
Oh, you
Yeah,
want to need one more?
I do.
Josh, you got one?
There's one coming. I don't have one either.
Public Health Director, Kathy McGaff.
Thank you.
I apologize for making the last Board of Health meeting. Kind of
It
together here.
happens. It happens. You guys, I think you were actually in one of these meetings at our
Yeah.
last one. So,
There you go. There you go.
and of course, I've got Melissa Setzer here with me. She's our finance director for the health department and knows our budget inside and out, and I couldn't do it without her. She manages not only our entire budget and our billing and our purchasing, but also the clerical folks up front, so I couldn't do this without her. She's my right hand.
Is that microphone on?
Yeah.
Can you hear me? Can you hear?
Yeah.
Okay. All right, first thing I was gonna show you is, I tried to get all of our staff on one slide for our org chart, so that you can see where we have basically 4 primary categories of programs. We have personal health, which is our clinical services. We have environmental health, and we've got admin, and which is what I just talked about, what Melissa is over, and also our population health section, which includes our dental program, animal control, and our health education staff as well. So you can see there we got quite a bit of staff, and I've tried to show where we had some vacancies. This is kind of another way of looking at our staff, and I tried to break it down just a little bit more into particular sections so that you can see how many full-time staff we have for those program areas, and how many part-time staff, and how many are filled, and how many are vacant. Like many of the other departments, 76.8% of our budget is salary and fringe. So a vast majority of our budget goes to salary and fringe. Of course, we talk about staffing struggles. I mean, we're dealing with it as well as all the departments and many of the private sector and so forth. A majority of our vacancies are salary positions, many of those positions require a four-year degree. It's very difficult to find our nurses, our environmental health specialists, our nutritionists. It's hard to be competitive. And it's not just Macon County's problem. I mean, all the western North Carolina counties, even all counties across the state are struggling in that area. I wanted to highlight a particular concern that I have. I've discussed this with Derek. Environmental health. So for example, we had a candidate that we hired in June of 2022. He was authorized in Wells on November 2022. It takes a while getting them trained, and so they can't write the first permit until they're authorized in that particular program. Authorized in on-site wastewater in January of 2023, and he's leaving us in June of 2023. He's shared with me that he's accepted an offer for $59,000 a year plus a $5,000 sign-on bonus. And our comparable position, so once they're authorized in here for a year, they can, they go out of trainee status and are like paid at the full environmental health specialist rate, and that's $45,488. Just so you see some comparison. It's a struggle. I mean, it's really a huge competition out there, and you know, it'd be foolish not to go and work and make, you know, $59,000 versus $45,000. So he's a young person trying to start a family, looking at what it's going to take to have a house and so forth, and you know, running numbers himself, and we just can't compete with that. And we continue. I know I talked to Derek. You know, we continue to have the struggle, and we continue to talk about creative ways that we can address it. You know, is there some sort of retention bonus? Other counties are doing sign-on bonuses, you know, things just to keep our staff here, because we put the chart below there is kind of an estimate of what it's cost us to train that gentleman for the year. If you look at about 6 months worth of training, you know, his salary and fringe would be $31,388. And then the time that Jonathan spent training this gentleman, I mean, on top of everything, we estimate about $10,000 of Jonathan's salary is devoted to just training these individuals. And then just the travel training alone is $1,800 because they have to go to Raleigh twice, and you know, some of it they do online, but there's trips. So it ends up being quite a bit of expense for us as a county to train these gentlemen, and then for them to turn around and leave for another county. It's just something, you know, that we need to think about and try to be creative as we look forward for filling these positions. Some of the activity variances that we've seen at the health department, you know, it's been the last several years has been quite the roller coaster ride for us. I mean, we've switched gears many times in the last few years about what we're focused on. What we've seen after the COVID pandemic and animal services, and with this economy, is that we're seeing an increase in intake in animals. 2 years ago, we were averaging 60 animals a month. Last year, we averaged 100 animals a month. Last month, we hit 151 animals in 1 month. It's the highest we've ever had in coming into animal services. So that's, you know, increase in number of immunizations that we have to give them, increase in the food, the supplies, all of that is increased as we look at it. And of course, the calls are up, and we're trying to respond to the number of calls that we have in the community too. Another activity that, you know, that we're looking at and how it's impacting us is in the dental program. We've worked on the molar roller, and Josh, you know, we've followed your guidance, and it's been in repair a couple of times. So we've had that unit down about 10 weeks this past year. So that's, but definitely needed. No point, we couldn't even have moved it without getting it repaired. But, that's 10 weeks that they're down not providing services. So that does have a cost associated with them being down as well.
When was it? I don't mean to interrupt you, but how old is that unit?
I'm sorry, what?
How old is the current Motorola?
About
20 years old in March,
How old?
20 in March.
So I think we replaced 2 hydraulic lifts one time, and then it went back and got 2 more hydraulic lifts replaced the second time. But, they're doing the best they can with it. It's amazing it's hung in there this long, actually. Some of the environmental health activities, you'll see that we, in April, May there, we're still having applications come in, more than some of the other counties surrounding us. So that's not really slowed down for us. The other counties have seen somewhat of a slower pace, but we're still clicking along with applications for both on-site and wells.
How far behind are they now, you think? What's the backlog?
We're telling people 8 to 10 weeks. I think 8 weeks is probably more reasonable right now when we look at the actual number of applications and where they're at. They're about 8 weeks out. But, something like a couple of repairs that we have to focus our attention on can divert that, make that a little bit longer. So 8 to 10 weeks is what they're saying.
I think, Kathy, one thing to point out too with that is, this is going into this budget year, is the first time that we'll have until you had the recent announcement of the person leaving, it would have been the first time we'd been fully staffed since October of 2020,
20. Yeah.
right?
Yeah.
So,
I mean, Jessica and Charles and John and all of them have done a great job filling those positions, and we've got a great crew. They get bragged on by the regional consultants that work with them, and some of the installers have really thought highly of them. So there's a great crew of people. I mean, I just want to keep them. Want to do what we can to keep them here. We are fortunate that a couple of them are local folks, and they'll, more likely will stay with us. So I am hopeful with that. With food, lodging, and institutions, most of those numbers with restaurants and pools and stuff are about the same that they've been for a while. We saw during COVID several restaurants closed, and we're just now getting kind of back up to the speed that we were prior to COVID with restaurants. The one thing I do want to point out is we got 18 tattoo artists. 4 years ago, we had maybe 4, 5. That number has really jumped in the community. So, and those, they have to be, go through an inspection,
And their permits,
Permitted.
are they still $700 or?
I think so. I can't remember.
Yes, for the actual facility itself, and then each person inside is
Is the same?
500.
This is something I want to point out for our clinical area. Back before the COVID pandemic in fiscal year 2019, on the left there, you can see how our payer mix was with our, who was coming into our adult health, primary care, and so forth. That's kind of shifted a little bit. We're seeing more Medicaid and Medicare. During COVID, it was actually skewed because we had a lot in the Medicare, because we were doing a lot of COVID vaccinations, so it really kind of jumped those numbers up. But now that we're more towards the normal kind of activity, we're still seeing Medicaid and Medicare being the highest part that we're seeing.
okay, is your private pay, would that include the employee clinic and stuff, right? That would
Yeah,
be
yeah.
included in the rate.
If we're in a situation, not for employee health, but if we're charging a county employee, if they're coming through primary care, we do, that's private insurance that we see. Okay, this chart, I'm gonna let Melissa take over for this this chart, it's quite in depth.
So, what we wanted to try to do is show where all of our funds come from. I'm sorry, I've been hoarse. Our funds, we pull from 8 different places to fill our budget. If you'll see the first column, it is the total cost of what our budget is projected to be for the next year. The next column over is what is projected to be that the county would actually support and pay for. When it comes to our agreement addendas, which are agreements and contracts we have with the state and have to sign each year, our state and federal funds are delivered through those. Federal funds are pass-through funds, so they actually go into the state and then come from the state to us. There are a lot of obligations that we have to do with each one of these agreement addendas in order for us to draw down these funds. We also showed our different Medicaid funds throughout the year, our Medicaid cost settlement, which is our big Medicaid report that is generated each year for the overall. Next, we have our fees. This is based off of fees that we would actually charge. That would be well fees or patients coming in, paying their bills themselves. We also have donations that came in each year. These will vary year to year, but we normally base it off $1,000 per each. And then we have several of ours that come in with grants. The bottom 2 are our Mountain Wise, which are regional programs that are fully funded with grants. So this kind of gives you an overview of the 8 different places where we are pulling funds to support our budget.
At the bottom,
We need all those, I mean, or any of these programs, I mean, we never seem to evaluate or, I think we did eliminate adult health, adult dental,
Oh, yeah.
dental, dental.
Yeah.
a lot of these.
I mean, there's, some of these programs, if we don't provide them, we'll have to assure them. So, it's where we would have to make sure that that service is, available in the community. You know, if we don't provide them specifically for ourselves. And we've, at different points, I think there's been discussion, for example, like child health. At different points, we've talked about, is it better to just contract with a provider and let them provide, so that they'll provide services to someone that doesn't have any insurance or, you know, low income wise. But at the same time, you know, we've got to consider, do they have the capacity to handle that? You know, right now, the pediatric offices are, you know, it's really hard to get an appointment right now because there's just so many children to take care of in the community. So we can't give those appointments up. They're, you know, they're needed in the community. So there's different times we've talked about that. Right now, we feel that, you know, that all of these are necessary. Looking at what we're seeing in the community and hearing from people.
Can you help break down this molar roller and the cost associated with Macon County? Do we generate any funds, you know, on an annual basis, maybe through pass-through or accrual or, you know, cash basis?
So,
What does it cost us on an annual basis, I guess is what I'm asking, year over year to run it?
for the program itself,
Yeah.
you can take, let's see if this may go. So the actual cost that we budgeted for the molar roller is $869,983. The rest of the cost of the program is for the actual dental program.
I guess what I'm asking is, does the county 100% support the molar roller, or are there Medicare pass-through federal
Yeah,
funds
there's
that
a-
fund
yeah.
this? on a
Majority
recurring?
of the years, dental is the closest program we have that covers for itself,
That's what I'm asking.
yeah.
Yes.
I mean, they, between what
Where,
they receive.
where is that on here, I guess is
Okay,
maybe
so
a
if you
direct
look
question.
at child dental, that $1,422,000 includes the cost of the molar roller,
Okay,
okay? So the actual county portion, that $581,000 right now is, the portion that we're asking, that's kind of, it includes what we're asking for the molar roller and for the program. So in years past, and Lori, I mean, you can talk about this as well. That program between billing for Medicaid, billing, private insurance, and patient pay, what people actually pay, it gets the closest to covering for its own cost than most of our programs. It's been down just simply because, for example, we've been down for 10 weeks, you know, this year. So they're not quite making it this year because they just haven't been up generating that revenue. Then, on top of that, this Medicaid cost settlement report that we talk about, that's about approximate half of that cost settlement is generated by the dental program. So they're the reason, half of the reason why we're getting that money back.
Okay, so I had two more questions, and I was gonna hold to the end, but they might tie with this. Like, I noticed, I count 11 vacancies, right? I imagine you cover those salaries in the budget. Where do those salaries go whenever they're not used? Is there a fund balance?
It just comes back to the
Yeah.
county.
It comes
It'll
back
roll
to the
into
county
the-
general fund?
Yeah, and if it's like a position, for example, like a school nurse position that is actually funded by the state, we get
Okay.
state funds for it, we're not able to draw that money down because it was been empty.
So I guess to answer the question is, if the salaries are not used, they go back into the county's budget.
Yes.
Okay. And the last one, while I've got you, well, two more. Did we lose that gentleman to another, like, government municipal office, or was it the private sector?
No,
Are you allowed to
so-
answer that?
Yeah, government,
Municipal?
county,
County?
Mhm.
Okay. And how are?
same job that he's.
Same job, different county.
Mhm.
Are we able to supplement some of these needs by contracting? I mean, how's that going? Are we still able to do that? Is there?
Because we had gotten to a point where we were fully staffed, when Derek and I talked about the contract workers, we didn't budget, we took that out of the budget for this coming year. Because by the time we get them authorized, we felt like they would be up and going for most of, the year, and we wouldn't need the contract workers. As long as we don't get a bunch of vacancies. I mean, this gentleman's leaving, and we're gonna start advertising immediately to try to replace him. That's the balance that and usually, if we have a bunch of vacancies for a while, we may use that lapsed salary to pay for contract workers, if we see that we need it.
The county that we lost them to, is it a bigger county?
Yeah, somewhat, a little bit, not, I would say it's, like a Henderson size.
Where was he from originally?
Foothills area,
Where? That way,
yeah,
toward Randolph.
I will say that $59,000 for that position is at the far out of line with any comparable that I've seen when looking at it.
yeah. I mean, it is a lot, but
It's
it's
just, that's
surprising.
That's pretty
That's
high.
significantly over what the regional average is, what the,
Okay.
for our region and what other counties surrounding would bring somebody in the door at. That's astronomically high.
So like what we're offering, it wasn't like low.
No, what we're offering, I mean, and it's coming fresh off the salary study, and we continue to try to do these cost of living adjustments and things to keep competitive, but this is one of the positions that, like we highlighted in the budget message, certain positions like this that are tied, they're in a little bit more high demand than others, because they're tied to construction industries, and like that was a great question that Commissioner Young asked about losing to a private sector or public sector. A lot of times we're losing them to the private sector because they can go out and get so much more money. This just so happens that this county paid an extremely high starting rate for this position, but that just goes to show you that how far that people are willing to go and the demand that these certain positions are in. I think that's a good example of that.
And I think that, other counties are, it's this constant salary study to try to get their county up to competitive level with other, it's just constant, like, you know, I think Jackson County is doing, they just finished one, and they had done
Yeah,
one
they're-
like 2 years prior.
And basically, this year Jackson County recommended the same thing we did as far as cost of living adjustment and step increase.
It's a difficult shuffling. I mean, even as we talk with health directors amongst ourselves, we know they're all shuffling based on the money, you know, where they can get the highest salary.
No movement on reducing the required science hours,
Not that I've
so
heard.
that's just dropped off the
Now,
edge.
that is, that was looking pretty favorable, and I don't know how that, I'll have to check up on that, but I talked to, the North Carolina Association of County Commissioners, and they were feeling pretty good about that going through. So
Some
I'll
states-
follow up on that.
Some states are eliminating four-year degrees up in the Northeast, and we've talked about that a long time
I know.
before you that tonight. Go ahead.
Okay. Did you have any more questions?
No, thank you.
You're welcome. Okay, so, this is basically our budget. This chart is basically our budget in a nutshell. I mean, this is everything. We've got, of course, a lot more detail in our records about what this money reflects. But the biggest things to point out is that you can see that, the county portion of our budget is 56.3%. And that has varied at different times, anywhere from 49%, and, you know, right at that level, it's around 50%. But keep in mind, this does include the mower roller in this budget. So another notable expenditure that, I wanted to talk to you about is our physician position. So as our physician started talking about retiring, and you know, he's been with us for years. He's a great gentleman, Dr. Dewhurst. Talking to Mike and talking to Lori about it, they were really encouraging us to look at moving it to an actual county position because of some of the requirements that it met, that makes it more like a county position rather than a contract position. So we have basically figured our budget to include it as a actual county position. Now, we did include some contract money that in the budget so that we could have an overlap period between the new physician and Dr. Dewhurst, and he's willing to do that. And there's a couple of reasons, not just for sharing the experience, but in order to get a physician credentialed so that we can actually bill under that physician's name, it takes time to get them credentialed, sometimes up to 3 months. So we would be dead in the water billing if we didn't have Dewhurst overlapping with our new physician. So we did keep a little bit in the budget for contracted services so that we could overlap that way. Obviously, we're looking at the physician being a full-time position for us, where Dr. Dewhurst right now is a .70. He's not quite full-time. So that's a little bit more of expense. And then most of the expense of the 92,544 is obviously benefits, where we're not paying Dr. Dewhurst benefits because he's a contracted position, and if we have county employee, then we gotta pay the benefits. One reason we looked at increasing it to full-time is because we're anticipating with Medicaid expansion, there's not a lot of physicians that accept Medicaid in the community, first of all. They're not gonna be able to accept an increase in the demand. They're not gonna be able to have more appointments. So we feel like they're gonna be coming to us, looking on how to use this new insurance that they have. So that's another reason why we talked about making that position a full-time position. We also are looking at, we had a position, a coordinator position in animal control. Recently, Jimmy Billiard, who was over animal control originally, took on some additional responsibilities and was promoted. And so he handles animal control and several other, like our health ed section and our dental program. And by doing that, that kind of left open his old position, right? So what we're requesting is to change that position to an actual animal control officer who will increase our capacity to go out and respond to calls. To do that, though, we have to ask for a truck and a dog box. So it's, Jimmy's old position didn't have a truck, and a dog box. He didn't respond to calls. So the new position, we have put in a request for a new truck and a dog box. And of course, with the molar roller, okay, so Medicaid, I talked to you about Medicaid cost settlement. This past, for the fiscal year 22, when we got the report back for Medicaid cost settlement, it is significantly higher than what we've typically seen in our Medicaid cost settlement funding. We conservatively budget $250,000 for Medicaid cost settlement. We always hit somewhat over that. We've never hit this high. So basically, it's because during that year of 2022, we were seeing a real large portion of Medicaid clients, and we were able to, when they ran the formula to calculate our costs and what we needed to be reimbursed, it just turned out to be that much. Now, they will hold 10% of our Medicaid cost settlement, which was about $907,000. So 10% minus 10%, it ended up being about $816 that we've already received the money this year, and I think we're gonna roll it over, right, for next year. So, because we typically budget $250,000 in administration for Medicaid cost settlement, we left that part out, and we're asking to use the remaining balance towards the purchase of the new motor roller. So therefore, our request for funding from you for the motor roller is that much decreased, and we don't need as much. A couple of months ago, you guys asked us to go and issue a bid to get numbers. We do have those bids back. I think next month, Derek, we're gonna come to you with those bids and our recommendation for the actual particular bid that we think we should go with. So we feel like we're in a good position, and if you guys have any questions about that, I'd be happy to answer that.
Where's the current unit at?
Right now, it's at MPP.
Pardon?
MPP.
And it stays there how long?
It'll be there through the summer. Till about September.
Is there, oh, I'm sorry, go ahead.
No, go ahead.
Is there any value to this existing unit?
I think
What are we
so.
gonna do? So that would actually be offsetting,
Yeah, because
If
it'll,
we get to a point where we can
Yeah.
sell that off,
it will be surplus.
it will, we can put that towards it.
any ideas what a,
I don't know what a
Yeah.
20-year-old,
Good
really.
news. Mike Cope said interior was good, solid.
Yeah, it's just mechanically, it's got.
The mechanical hydraulics. And you move it 2-3 times a year?
Yeah. Sometimes about 4. Depends on the year.
How confident are you on this $870,000 new unit? I mean, are those bids pretty
Yeah.
accurate?
Yeah. Very confident.
Yeah.
This particular company, you gotta realize that, it's 20 years old. It's got a good track record with us. I mean, it lasted quite a while.
Years ago, when we got into the dental services, it was based on primarily, nobody took Medicaid.
Mm-hmm.
Where do we stand now with dentists in Macon County
They,
accepting Medicaid?
I know one, maybe two, but I do know only one.
they don't take any new appointments right now either. So they may say they take Medicaid, but
Yeah.
they're not accepting new patients. So we're really the only game in town. Now, when I looked at some of the requests for services information that we have, when it rolls into a new school, about 30% of the enrollment signify by a sheet of paper that they turn in that they want molar roller services. So we can only see about 20% of the enrollment. If we're, to space our time out between schools, we're only seeing about 20%.
So can any kid have services provided by this?
Yes,
Whether they have insurance, they don't have insurance?
Yes.
yes.
We
No,
take,
that's not true. My grandkids tell me to go all the way to past Ash.
It depends, if they need more higher level care,
yeah.
they may have to go and, go to another dentist that provides that level of care. We can, there's a limit to what we can do on the molar.
I guess what I'm asking, to me, if a child doesn't have insurance, doesn't have, the parents don't take them to Asheville to Medicare, Medicaid, or wherever they go, this is an option for them. Look,
It is. It's a self-pay situation where they have to pay out of pocket, but yes, it is. And we have a discounted rate,
and
like
those
they're,
fees are
It
public
does
and
slide.
scheduled and.
yeah, they slide, depending on their income level.
What about your Nantahala community? How do you cover that?
That's been a struggle, because it's very, we can't get the unit up those roads, and so we've worked with different, like when it's at Cartuga J, we work at trying to get those appointments scheduled, and sometimes the school has worked to get the kids down. Sometimes the parents, that's as close as it gets, so the parents will bring the kids down. We're trying to be creative. Now, we do go up to Highlands. We're not going up to Highlands this coming year because of the shape the molar roller's in, which is, it's a shame that Mike is worried about the shape of the molar roller and getting it actually up the mountain. But we have gone several years up to Highlands.
So is it because of the shape of it that you can't get to Nantahala?
No, it's also the roads.
The roads?
Yeah.
That unit weighs about 80 gram plus the truck.
You can get there, you just gotta go through, you gotta go the long way.
Yeah.
You just can't go while you. You gotta go through Clay
I'm
County,
not the
yeah.
one that has to transport it, so.
And the other surrounding counties have this service.
They don't. They have, one has a stationary, well, actually two, have stationary clinics but the kids have to get out of school and come to them. When we talk to other health departments, they just love this model because we don't have a no-show rate. We just pull the next kid, If there's a kid absent for the day or if they're on a field trip, we just keep going until we pull them, find one that's there that day.
Anything else, ladies?
One thing I do want to, because I've heard you talk about these comparisons, just so that you know, our budget comes in right at $7,100,000. If you take the molar roller away, it's $6,295,000. We also have some regional grants that aren't they're regional positions for the entire region. They're just housed with us, and their expenses matches their grants. I mean, there's no other expense and no other money asked for from you all. So just so that you know, our budget comes in around, without those two things, $5,859,895. It's real close to Jackson and Haywood. That includes animal services. So both Jackson's Animal Services is in that number and Haywood. From last year, we're up about 3.5%, which that includes the cost of living raise and the step raise. So we're really trying hard to keep the budget flat. And
Yeah, I think if you took that.
I mean, the molar roller is a definite jump in the expense, but it's a capital expense.
What percent of that whole program is dedicated exclusively to the Board of Education?
I mean, majority of it, I would say, we see MPP, we will see, kids in private schools and stuff, their appointments are after 3 o'clock, but I would say 95%.
And it's reflected, the cost and everything's reflected to the general fund instead of versus the.
And you've got that, so you'll have the child dental, and then you'll also have reflected in our general fund budget,
school
the
nurses?
school nursing.
And let her explain, give us a quick update on school nursing.
So, school nursing is one of those programs that's struggling also to have positions filled. It's just the nursing industry is just so competitive with the private sector right now, and it's just hard to touch that. So we've not had applicants for a long time for school nurse. The school system has, I want to say it's 2.2 FTEs of school nurses that they've hired through the ESSER funds at a higher salary than what we are able to pay them on our salary pay grade.
And I think those go away.
Yeah, and those ESSER funds, when they go away, I'm not sure, I can't say what they're gonna do with the school nurses and what the
They
request
told
is
us
gonna be, but
all those ESSER, 18 employees under ESSER would disappear. So how many school nurses are,
so we have 2 of our 5 positions filled.
okay. And that's, during the school year, what are they doing off year? Off,
They don't work, they work 10-month employees.
Their
So,
salaries are prorated though, right?
yeah,
and that's not reflected, I didn't mean to interrupt you there, Derek.
No, their salaries are prorated, so they stretch them out so they can get paid over 12 months rather than 10.
But it's run through the general fund and not
Yes,
the
sir.
Board of Education allocation.
No, that's in addition to the annual appropriation to education.
The same with SROs. What about nutrition? Your
that's
nutritionist,
that's just, our nutrition WIC, in our
Is
WIC
WIC.
area, yeah, that doesn't have to do with the schools. It's the
I didn't
federal
mean to
funds.
interrupt you there, Derek. You got
Oh,
another
no.
one?
I didn't have any, I was just seeing what she had mentioned their operating budget. And I'm gonna get you the outside of the salary and benefit increase to the health department.
While he's doing that, animal control.
Mhm.
So you're gonna have two officers now.
Now that one, if we get the 4th, it'd be the 4. We've got 3
Four
right now.
patrol
Mhm.
officers. And you run how many animals a month?
100, we had, this past month, we had 151 intake, yeah.
And that's just intakes, that's not calls.
Yeah, that's not calls, that's not adoptions, I mean, that's just, the reason why that's so important is because they are working extremely hard. There's only a maximum number of animals we can actually house in the shelter. We have a capacity. And so they work extremely hard to get those animals out and adopted or transported to other areas that are keeping, still doing adoptions. And they've still been able to maintain one of the lowest euthanization rates we've seen. I mean, that's their goal, is to keep that down.
And are y'all, go ahead.
No, I was just going to ask if they're on call. Is that a 24-hour day service? Animal control,
If they're
or
on
is
call, yes. I mean, they have to
They
respond.
do have a call out
Mhm.
from them.
And any interaction between your agency and the
Sheriff's Department?
the shelter?
Oh, yeah, that's,
Humane
they're hand in hand. I mean, I think almost every weekend I know is that they're doing an adoption event somewhere in the community. They've been at Tractor Supply,
A little
they've
bit
been
everywhere.
everywhere. And our staff has been great to coordinate that, and they make sure, one of them goes out with them and make sure we try to get all the animals adopted that we can.
On your operating budget, outside of your salary and benefits, health department's operating budget is down $281,414. That's all their non-salary and benefit-related operating expenses. A lot of that's due to contracted services. Of course, you had a large amount of contracted services with the contract doctor that will roll out of those non-salary and benefit-related operating expenditures, but they'll be reflected in salary and benefit
Right.
increase. You also had your contracted services in your environmental health and wastewater. That's about, or your on-site wastewater and wells. That's going to be about another 50,000. So the majority of that's contracted services. I think there was a grant that went away as well.
Mhm.
So like you say, done a great job. Just another example of a department that's done a great job holding the line with those operating expenses.
We still have a little bit of COVID money left. I mean, I think we've got like the ESSER funds, we've got a little bit of time with some COVID money. And anywhere that we can they get, you know, it fits, that there's an expense that we can use the COVID money on, we're working to do that as much as possible, to use that money up.
Anything else, gentlemen?
Good job.
Ladies?
Good job.
Thank you.
Thank you all for coming. Thank you for what you do.
Yeah.
Okay, we have public health. Who's next, Derek? What do you want to do?
However you want to do it, Mr. Chairman, we can do,
Chris?
we can do Department of Social Services, since that's in the Health and Human Services function. They can come right on up. Patrick and Kathy, glad to have you tonight.
Thank you for having us tonight, Mr. Manager, Commissioners. Before I get started, I just want to point out that apparently Macon County has adopted a new uniform that if you are about to retire in a week, you apparently must wear a shirt with sailboats on it. I'd like to point out tonight that Kathy and Mike both, who will be retiring in a week, have decided to wear their sailing outfits today. I wasn't aware of that. Hopefully I'll get that memo when I'm closer to retirement.
It'll be a flat bottom.
It's going to be a flat bottom.
Yeah, we'll have John boats on ours.
There you go. Let's see here. Let's see if I can get this to come up.
Yours is when, Kathy?
Next Friday.
16.
A week from tomorrow. 1 to 3
Here?
at the community building.
I can't keep that. Get so many
Mike's in
people
tomorrow.
retiring.
So there's nothing to interfere.
35 years? 35?
Almost 31.
31? Mike, how many you got?
Almost 31.
These two folks, for you that don't know, are retiring this month. Very valuable employees. Vital, I should say, very vital employees.
Absolutely.
Only takes 4 to replace you.
That's not a
Each
stretch.
of Got her?
I think so. Technology is not my strong suit, if I can be honest, Mr. Chairman.
Nor mine.
So just wanted to start off by giving you just a quick overview of the Department of Social Services, what it is that we do and how we try to do it. Department of Social Services is responsible for more than 30 federal, state, and mandated services, as well as 10 community services that are provided through our senior services. Macon County Department of Social Services, we like to say that we serve folks from the cradle to the grave. We have programs that take you all the way from Medicaid for pregnant women, and then we also have programs that will take you all the way to the grave, unclaimed bodies. It's one of my favorite program areas, actually. We have 68 full-time employees and 6 part-time employees. Most all of our services, mandated services, are funded primarily through federal and local dollars. There are some state dollars sprinkled in there a little bit. But there are a few of the services, the mandated services, that are unfunded, and they're covered only by county dollars. Kathy's going to come up in just a little bit and talk with you about the 30-plus different funding streams that we have coming into the Department of Social Services. Well, what I want to speak primarily to tonight is North Carolina's Medicaid expansion and how that impacts our budget request for this year. As you know, House Bill 76 was signed into law on March 27th. That expanded Medicaid in North Carolina. This, the law was signed in, or the bill was signed into law, but it has really 2 components to it. One, we've got to get, the state must get approval from CMS, the Center for Medicaid and Medicare Services. And it's also tied to the state budget, the passage of the state budget. So while Medicaid expansion is on the horizon, it has passed. Of course, the fiscal piece of that is going to impact how we roll out Medicaid expansion. So you've seen the news. There's going to be approximately 600,000 additional North Carolinians who will gain coverage, in addition to the 3 million current recipients. At this time, there are approximately 10,000 Macon County residents who are currently enrolled in Medicaid. We have about 12, Sheila, don't shoot me, but I think we have about 12 different Medicaid program categories, not including the categories that were temporarily lifted up during COVID. Is that about right? Just to let you know that we've seen an increase over the past 4 years, as has every department. We've seen about a 38.1% increase in the number of enrollees from May of 2019 to May of 2023. Statewide, we've only seen about 36, so we're slightly ahead of the state in that regard. And just as a note, during the public health emergency, we were not allowed to terminate any Medicaid cases. So that's why you've seen the inflation of the enrollees over that period of time. We get our information from the Division of Health Benefits. It's a division of the Department of Health and Human Services. They have estimated that Macon County will see about 3,239 additional Medicaid enrollees in Macon County. We currently have 11 income maintenance caseworkers, eligibility workers, if you will. That's their sole function, is to determine eligibility for Medicaid. And we have about 11 folks who do that. The downside is that while DHB has given us an estimate for how many folks we'll see coming through the door once Medicaid expansion is fully lifted, they don't provide us with any recommended caseload standards. You may have heard me before come up and talk about caseload standard recommendations over on the social work side of the house. For Medicaid and food and nutrition, the Department of Health and Human Services did not provide any type of caseload standard. So if you just average out those numbers that I've just given you, we have about 900 plus enrollees per eligibility worker right now, processing both new applications as well as recertifications. And you'll remember that last month you approved income maintenance, or excuse me, in April rather, you approved an income maintenance trainer position in anticipation of Medicaid expansion. We've been able to fill that role. It was an in-house hire, and that person has already begun doing some training with our existing Medicaid staff. So thank you for that. We sincerely appreciate that. This year, with the upcoming budget year, we're asking for 3 additional income maintenance caseworkers there at $170,000. That request is 100% covered by legislative appropriation. That 100% reimbursement covers not only salary benefits, but it also covers the infrastructure supports. So it costs the cost of space, the overhead, any kind of maintenance, or excuse me, like computers and any type of equipment, telephones needed to support those workers. One thing that we're not 100% sure of at this point is whether or not Medicaid expansion, if it's allowed through Center for Medicaid and Medicare Services, the legislature put into effect some work requirements around Medicaid expansion. And so we're not sure what those work requirements might be. But as someone who always sees the glass as not only half empty, but usually empty, I'm going to take a guess and say that some of those eligibility requirements for work are probably going to be landed on the shoulders of departments of social services. It's important to know that Medicaid eligibility determinations are probably one of the most tightly audited programs in this county. In addition to single county audit that we undergo every year, in which, because of the dollar amounts threshold for Medicaid, that's always going to be included in those audits, we have at least, I would say, probably 3 or 4 different Medicaid reviews from the state itself. We have one that's referred to as RETA, Recipient Eligibility Determination Audit, in which they pull 300 cases. Regardless of the size of the county, they pull 300 cases, 30 cases a month for 10 months, or excuse me, 10 months, 30 cases a month, and they go through it with a fine-tooth comb. It is, again, one of the most tightly audited programs that the county operates. I just want to draw your attention to the fiscal note that went along with this legislation. You can't really see it. I tried to blow it up as much as I could, and I still can't see it. But the fiscal note does provide 100% coverage. What you see circled there just simply says local impact, and there's lines all the way across. So the way that that breaks down is in state fiscal year 23-24, the state will receive about 24 million in startup costs. 24-25, you see the figures move on from there, and those are spread across the state based on the Medicaid population size. So in fact, Macon County has actually already received some upfront funding for Medicaid expansion. We received an indication that we were going to get $45,282 at the end of May. Well, it didn't exactly come at the end of May, but I was told today that the check is in the mail, and it will be here sometime next week. It's the state who's sending that check, by the way. Those funds are to be a bridge, if you will, from May to September's time frame until the funding for Medicaid expansion that's allocated in Session Law 2023-7 is anticipated to become available. After state fiscal year 27, those 100% coverage costs will likely roll down to what our current funding levels are now, which is, it's a little bit complicated, but roughly an eligibility worker is reimbursed at a rate of 75% as long as they are conducting what's called E&E activities, eligibility and enrollment type activities. If they aren't doing E&E activities, so for instance, if they're in a group training in which there's not a specific case that's being discussed, or if there's a fraud investigation, or if they're doing quality assurance reviews, we get reimbursed at a 50% level. And again, it's worth noting that 100% covered, reimbursement covered salaries through 2027. A little bit more information about what the state has given us in terms of how they intend to support county departments of social services to uplift Medicaid expansion. And they'll talk a little bit about the technology supports. So the way that we process Medicaid applications is through a eligibility determination system referred to as NC-FAST, which it is anything but. But we have to use that system to determine eligibility of each and every application that comes to the Department of Social Services. During the period of Medicaid expansion, the Department of Health and Human Services is talking about using the federally facilitated marketplace as a possibility to direct folks to apply for Medicaid expansion. We certainly, at the Department of Social Services, would support that type of a lift off of the workload for the county, but more importantly, it also shifts the responsibility of if a mistake is made in the eligibility determination at the federally facilitated marketplace, or the FFM, that mistake does not come back to the county. It goes to the state to cover that. Just so you're aware that anytime a case is determined to be held in error, if an individual is deemed to be receiving Medicaid benefits and they're not eligible for those Medicaid benefits, the county is on the hook 100% of those Medicaid costs incurred during that error period. So I think I heard the sheriff come and present about one inmate who had a $50,000 health bill. If that time frame that person had been, if they had been on Medicaid and that one bill had come in, the county would be responsible just for that one error alone for $50,000. So again, you can see why this program is so tightly audited. Some additional technology supports. They're talking, what you're seeing here is just some information about what's referred to as straight-through processing. I know that most of you thought that STP was a motor oil. It really is straight-through processing, and that idea is that if information in a family unit has not changed dramatically, and their need for Medicaid has not changed, then that process information goes through all the way to the system without a worker touching it. In advance of Medicaid expansion, DHHS has revamped its online application system. It's referred to as ePass. It's an English and Spanish public website for the benefits applications in North Carolina. What's important to know about that is while it is a public website that's maintained by the Department of Health and Human Services, each and every one of the applications that go through that system come to the local county departments of social services for actual processing. I will say again, being the pessimist that I am, that historically, any type of automation has not necessarily reduced the workload for departments of social services. You can probably look back in history and see where there might have been a time where we came before you and said, NC Fast is going to mean that we don't need as many eligibility workers. Well, the truth is, we probably need just as many, if not more, even with that eligibility determination system. So I appreciate the support that the technology might bring, but I'm not 100% confident on it. And then one last thing I just have to bring to you, in the words of the late Steve Jobs, one last thing that's not included in your budget packet is that we were made aware in May, late May, of a foster care rate increase in board rates that goes into effect as of July 1. There were, you may, if you follow legislation as it moves through the North Carolina legislature, there were a number of revisions to Senate Bill 20, and one of those revisions included the provision of rate increases for what we provide our foster families to provide care for children. So we received a notice in late May that says you're essentially on the hook for an additional $47,000 effective July 1. It may generate a contingency request from the department moving forward. The reason I say may is it's very difficult to determine at times what our caseload numbers will look like in terms of the number of children we have in custody. That changes on an almost weekly basis. It also is hard to determine that specifically because children change placement. They change placement actually far too often. And so if a child starts to exhibit, a foster child starts to exhibit a higher level of need of care, then that child might be in a foster home that we currently pay at $514 a month. But they might have to move up into a higher acuity level placement where we might have to pay $1,300, $1,500 a month just to meet that child's mental health needs. So I put a chart there so you can kind of see what the breakdown is of what the rate increase is that we can expect effective July 1. That concludes my budget presentation. I'm going to look at Kathy and or Sheila to see if there's anything I missed, left out, shouldn't have said. Come on.
Well, I'm Sheila Conley. I supervise Medicaid, all the Medicaid programs, besides other programs. And if you've never ever been to our facility or ever received services in our facility, you probably really don't know exactly the process. But I just wanted to say that along with our workers, and we do have good workers, but if you sat down, you took an application and you had all the information that you needed, it would take you a good 2 to 3 hours, and that is my strongest workers, processing an application. So it's, I don't want somebody to think that it's just a fly-by-night, because it's not. We have to get up in the client's business. They don't always like that, because we're looking, in adult Medicaid, we're looking at their assets, if they've got property, how many bank accounts they got, if they have a deed of trust, if they've gave away any property, any assets in the last 5 years. So it's not just, going through and looking at their income. We are actually up in their business. And a lot of people think they can hide their money so their kids can have it when they pass. But, so it's not just a It's just not like a 10, 15-minute thing. It really literally takes hours. Sometimes it takes days. I have personally, it's been a while since I've been on the floor, but we've had so many turnovers. I've had to work a caseload lately. But if you have a deductible, which a lot of you might know, it's kind of like your car deductible. You got to pay so much up front before the insurance will pick it up. Well, surprisingly, we're talking thousands and thousands of dollars in deductible. And they have to have enough medical bills to meet that. And we can go back 2 years and look at their medical bills. And so we're not only caseworkers, we're also accountants. We're also looking at their bank statements. We're looking at their property, having to read deeds of trust. And so, for those of you that don't know, I thought it was important to know what actually all goes into it, because it's not just reading a piece of paper and keying it into the system. A lot of times, whenever Patrick was talking about the straightforward or the straight-through process, and a lot of that is it can go out, the system can go out and actually see in the clouds on the internet. And if they can pull the information from the clouds, that's great. Not always does that work. Most of the time, they all fall out because there's some little something that it needs. But I just kind of wanted to bring that to the forefront, that it's not an easy program. It's very complex, convoluted. Since January, we've had about 50 emails, policy changes, things that they're auditing come down the turnpike. And you talk about it's hard to remember every little thing. Our manual, if you put our manual together in a notebook, it'd probably be about this thick. And there's no way one person can remember everything. You just got to know where to go to find it. So I commend all my workers because they do a tremendous job, but it is very stressful, especially when you have auditors breathing down your neck. And we do the best we can, but we do make mistakes. So hopefully with more workers, it might take the ease off of us a little bit, because you might have a little bit of breathing room. In the past year or 2 years, most of our redeterminations has been rolling. We can no longer let them roll. We have to work them. So you're looking at about 400 research every month, plus about 250 applications every month. And so it's very stressful. And in my adult Medicaid, in the last year, I've had 100% turnover. So that's when it gets really sticky.
I missed an opportunity to bring you a great visual. I should have brought in a Medicaid application just for you to take a look at. I'm going to take a guess, you correct me if I'm wrong, I'm going to say that, and we have them available in the front lobby if you ever want to just stop by and take a look at one. I'm going to say they're probably 15 to 20 pages, is that correct?
If not more. Mm-hmm.
If at least 15 to 20 pages. I'm reminded on a regular basis by the staff, it is not a data processing job. So if you have that in your head, it's just simple data processing, numbers entry. It is not that at all. As Sheila indicated, it probably borders a little bit more sometime on forensic accounting in the regard of, depending on the Medicaid program, of course, but it can be really incredibly detailed.
If we get a one person easy that you've got everything you need, oh Lord, that's fun. But most of them are not like that. I didn't mean to take up your time.
No.
But I just thought that it would be necessary to bring that out.
Thanks for sharing that.
Oh, you're welcome.
Patrick, the
open
thing that
question.
you had in your numbers a few minutes ago,
Yes, sir.
it's very concerning that 1/3 of Macon County population is going to be Medicaid recipients.
Currently Medicaid recipients, before we look at expansion.
Yeah, that's, I mean, we keep talking about the private sector. These are the people in the private sector out here, and in these Medicaid, recipients and everything else, so, that's just, that caught my attention there, that it's,
It's a large
our
number, even for a,
population is, private sector population is in trouble according to these numbers.
Yeah, those are Macon County residents.
those are Macon
Yes.
County residents, Macon County numbers
You can't go
only.
to Haywood County and apply. It's gotta be, everything centers, comes back.
Comes back to the county, that's correct,
Even
yes, sir.
through the E1, all that, or the.
E-Pass.
Whatever.
Yes, sir, you must, one of the eligibility requirements is that you must apply in the county for which you are a resident. It's just how the system is laid out, and it is a requirement.
Anybody?
This is just another area Patrick hit on that has a lot of positions within it that are hard to retain, that you will typically see vacancies, and it's simply because, you know, like you said, going from 700 to 900 cases
Yes, sir.
per worker, and then of these cases, I mean, the cases themselves, I mean, the stuff that these folks see on a daily basis that they're taking home with them, I mean, that's a lot for anybody as well, not to
It's
mention
hard.
the microscope that
Yeah.
that all the documentation they're filling out's under. So that's just a very high-stress positions over here that have a very high turnover rate, as Ms. Conley mentioned.
So I noted the conversation about, from Kathy's, from the health department, talking about a worker who went to another county. It was a far east county, Randolph, that might as well be on the coast. It was far east county, and it is a little bit of an abnorm to say that 56,000 is starting for that type position. But I'll give you one that hits a little bit closer to home. I just lost a worker to the former company for which she worked, private sector company, and they called her up and they said, if we pay you $10 an hour more, will you come back to us? And she came to us and she said, I cannot say no to that. What am I going to say? You're absolutely right. You cannot and should not say no to an additional $10 more over what we're paying. I mean, so there are positions that, as Derek pointed out, we have to be very competitive on. That's a great point.
Thank you, Pat.
Thank you.
do.
Thank you, guys.
John, thank you for what you do.
Thank
I
you.
don't know how you do it, but, you're not gonna be doing it alone, Ruth.
Derek, I'll be looking for that flat bottom boat memo on the retirement.
Yeah, if you have any
it.
questions, I'm glad to answer any of the financials.
Chris,
They're there.
Thank you.
what we're doing is just being educated. And, if you don't have a presentation, we'll get right into the meat of the matter, but,
I do have a brief
pardon?
presentation.
Pardon?
A presentation.
Oh, okay.
It won't be. Is this something functional or something that somebody left in? I just can't. Where's somebody plugging their math? Look at this. Where'd he go? Yeah, I know, but there's
I don't
something.
want all this. Was it dead?
I got it that time, I think.
There you go.
There it is.
Thank you. Sorry. Okay. We'll jump right past the introductory page. So the solid waste department, some very high level stuff. Pretty much just the table of contents, but one thing, because if you haven't gotten these calls, I don't know who keeps starting these rumors or misinformation, but if you see, I don't have a pointer. You see these two buildings right in the middle? One of those is the recovery building, the other one is the recycling processing center. So it turns out that trash and recyclables both go to the same place, but that's just because both buildings are housed in the same place. We don't put recyclables in the landfill. I don't know why I have to answer that question so often, but I'm assuming it's because both facilities are at 1448 Lakeside or whatever. But anyway, while I had the picture up, just thought I'd let you know that.
Hadn't heard that one.
Really? I get that call all the time. Of course, the other things you're looking at, you see on the left-hand side, sales phases 1 and 2, and phase 3 does not look like that anymore. It's getting pretty full. That's the black area to your right. In addition to the landfill and recycling processing center, we of course have 9 standalone convenience centers and the transfer station in Highlands. Just sort of an FYI, these bottom 2 pictures are some updated signage. We've got one of those going to every center over the next couple months, every center except for Carson, because we don't know the address yet.
You don't want to hang it on the Highland Road.
We're just gonna put it right out in the street.
Oh.
Now, we're gonna try to block most of the entrance so that people can't leave their trash there when we're closed. You would think such a busy road, but. So who we are, this is just a chart. We've got 10 operators plus 4 at the RPC. Then some admin staff, me, environmental health specialist, or field health specialist, I'm sorry, shouldn't have said that. Enforcement officer, a maintenance worker. And basically, all this rolls into the fact that we run an integrated solid waste management program, and take just a minute to tell you the short version of what that is, and then as we roll through, it may become obvious why I'm telling you that. But integrated solid waste management just means, in our little piece of the world, in Macon County, everything that happens to waste, we touch in some way. Whether it's trash, whether it's recycling, whether it's information on where to go with things we can't take, such as liquids or hazardous waste. The fact that it's picked up, whether you go to a convenience center or have it picked up on the curb, whether, every facet of trash, we may not do it, we are involved in it either through doing it or overseeing that it's done, that the services are available. So while the landfill is our mainstay and probably our biggest operation, we really branch out wide as far as other tasks involving solid waste management. Anyway, we got 20 full-time employees, 40 to 50 moving number part-time employees, primarily at the centers. We do have 2 at the landfill. We operate on an enterprise fund. What does that mean? To you guys, we don't get general fund money, and I don't know how much more than that you guys need to know, or want to know. But we are funded through 4 primary, well, really 2 primary and 2 secondary. Tipping fees, when you cross the scales, weigh in and out. Availability fees, that's the $108 or $108 fee that shows up on your tax bill every year. Then recycling sales and grant funding, and then some cost centers on the right. I'll jump to the next slide. This represents what I was saying. This is our revenues. Most of, about over half come from availability fee. Most of the rest comes from the tipping fee. And then state funds and recycling sales make up the rest. I don't know why it says other on there, but it's like $800 or something that showed up. I don't know, but it showed up, but it didn't show up on the pie chart there. Come back to that state number in just a second. So here's some major cost centers. I wish I could see that better, but we got our bond debt. This slide has capital expenditures in it, but the next one won't. It's the only reason I say that. Utilities, salary and payroll, or salary and fringe, state mandated costs, which can mix into a lot of those, and fuels, maintenance and fuel costs. I guess the one thing I would say is, unlike most county departments, our salary and fringe, is a little under 30% of our budget. I know that's counter to a lot of departments where it may be 90 or 100%. Moving along, this is just something to consider. I don't have capital money in here because that's not a recurring operational expense. But just to give you some idea, out of a $5.5 million budget, I know where $4.5 million of that's going the day I get the paperwork. It's just gone. It's fuel, financial assurance, bond debt, salaries. So there's really only there's less than $1 million in actual operations. Not that some of these other pieces aren't operations, but one of the biggest pieces of that is probably the grinding of brush and stumps, uniforms, office paper, mailings. So it's not a lot, we know where most of our money's going before we start. We've got very little to actually try to move around and get to the right place so that we make it through the budget season. One other thing, let me go back a slide. So I showed you a slide, the one actually before this, that said state funding, and it was that little yellow slice. So then I've got state mandated. Just to give you some idea, the money we have to spend to run state programs versus the money we get back from the state for having run those programs, there's about a $625,000 loss. So e-waste, white goods, scrap tires, these types of things, all big money losers. Plus the $2 a ton solid waste tax that we have to pay. So into the actual budget, I am looking for two fee increases. And these are in the budget package that Derek sent out. One is a $5 per ton increase for brush and stumps. At the time we set this fee at $30, we were paying about $9 a ton to have it ground. We're now paying over $20 a ton to have it ground. And it's not just the cost of grinding, I think a couple of you guys are familiar with mulch piles. These things have to be worked and turned and not catch on fire, and especially for us, there's a lot of moving parts. We spend a lot of time each day just getting stuff that ain't brush and stumps out of the brush and stump pile. Especially we have some clever construction guys from time to time that fill up all their C&D debris and then cut a couple branches heading off the job and put them on top and then try to get that mess up to the brush pile. So as you can see, not a huge impact, but based on the generation rate that we receive, about $20,000 in additional revenue to the department. Number two, I should have brought this to the board last year, and it was just an oversight. I guess I made a bad assumption, but early part of last year, the board approved a fee increase to our franchise hauler from $175 to $250 per pull from the Highlands Transfer Station. And at the Highlands Transfer Station, in addition to the tipping fee, we also charge an availability fee. And that fee is basically based on we can put 20 legally. We can put 20 tons on a truck. 175 divided by 20 is 875. 250 divided by 20 is 1250. So this is just a straight pass-through cost, and it only applies to commercial. We do not apply. I guess there's not commercial. The only person we apply this to that is not commercial is the town of When they bring in commercial, we charge them the tipping fee plus the transfer fee. When they bring in residential, we do not charge the tipping fee, but we still charge the transfer fee. And basically, this came about where it's kind of like, I mean, I'm not trying to treat the folks in Highlands worse. In fact, I think we're probably treating them better by having this type of situation up there. But the landfill is where stuff goes. And so if you want to bring it somewhere short of that and have us bring it the rest of the way, we just want you to pay the fare. If you don't want to pay the fee, if you bring it to the landfill, it's that we don't have to move it again at $12.50 a ton. So you can pay it or avoid it. But that's what that fee is. And the change requested is simply to reflect the change in the contract with our franchisee. The third one is also related to brush and stumps in Highlands, and that is in the fact that when we grind in Franklin, we can largely use up that in our processes in the landfill. When we grind in Highlands, we hadn't had a landfill up there in 15 years, and we've had a bunch of brush or a bunch of mulch generated since then. And so I'm asking that transfer fee, old or new, these are two independent things, I suppose, but that transfer fee be applied because we are having to transfer that material out. Those transfer costs are $20 to $30 a ton, depending on where it winds up going, what we wind up, Of course, we don't want to just bring it down here and have it pile up in a different place. We want it to go to some beneficial use if we can. And so our mulch contractor, our grinding contractor, we're kind of trying to work some details out, but to find other sources for this material. It's kind of been a trial and error so far. I didn't know what a cutthroat business the chip mills were, but I think the closing of the paper mill in Canton has had a big impact. You've got to promise these places, 500 loads a week, or you ain't getting in, or unless you can get a piece of somebody else's or whatever. But anyway, it's something we're still trying to work out on a longer term basis than just hit and miss when we grind. Can we get it somewhere? And of course, if we are able to avoid the costs of $20 plus, if we can get that down or eliminated, we would of course remove that transfer fee if we're not having to pay it. So
Can I talk to you about that transfer fee real quick?
yes, sir.
So does that apply only to like for-profit, let's say dumpster companies that provide a bin or a dumpster? I guess what I'm asking is, what is the definition of commercial?
Well, it's what you would assume. It's not exclusively brought in by a waste hauler. I mean, if you are a commercial business and you bring waste in, I'm trying to think of a commercial business that might generate some.
I mean, any excavating company on the plateau at that point would be a commercial business.
Correct. So if you're tearing down a house and you generate C&D and you bring it there, you bring it in your own trucks, yes, you're going to be charged the transfer fee.
I mean, where I'm going is, how do you differentiate commercial and private sector? If a guy pulls up in a dump truck, is that commercial or is that?
Yes.
Is that household?
Yes.
So pretty much the fee is just across the board, C&D.
C&D, trash, bulky waste, anything that we would charge a tipping fee on.
Okay, it's passed through.
Yes. The only, again, if you come to Franklin to the landfill with a couch or tore out cabinets or whatever, you have to pay a tipping fee on that. And you have to pay that in Highlands as well. But if it's John Q bringing it in, you don't have to pay the transfer fee.
Okay.
The only people are businesses, and except for the town on their residential. Again, the fee is, in that case, the fee is not because we're taking their waste, because we take it from convenience centers all over the county. It wouldn't be fair to charge for that. But the fee is, the town of Highlands, you're saving bringing that stuff down the mountain. 3-4 tons at a time, so you're just paying us to get it the rest of the way for you.
Contractors are saving time, you guys are paying, or they're paying essentially $12 a ton to haul.
Right.
So that's,
Yeah, and like I said, it is just a straight pass-through. Obviously, it doesn't cover everything because of the residential and whatnot, but it helps.
I understand.
Look at this, I'm almost done. You proud of me, Gary?
Go.
So it's just some, I just pulled out a few of our expense line items, and I'm looking at the last 5 years, but with so few data points, I don't think that those are confusing and not real meaningful. So I did trend lines. I didn't mean to make them squirrely, but these are just a little bit clearer. Except this table has two X, Y axis. Anyway, the top line is the cost for transport. And of course, we have the fee increase, but when we also have the increase in volume. And so our transport costs look like they've gone from about $380 to $430, so about $50,000 more than they were 5 years ago. Our costs. We'll switch to the other side for the rest of these, but fuel from basically 100,000 to just over 200,000. Our groundwater sampling, I'm going to come back to that one. Our grinding has gone from about 50,000 to almost 100,000. And then our groundwater sampling has gone from 50 to almost 100. So anyway, these 4 line items of basically support services to us have gone up 250,000, and I mean, none of that is reflected in an increase to my department. It's all increases into money that's coming to me so I can write checks to other people. I will say, just again briefly, I'm proud of the fact that in 21 years I have never come in here and asked for a budget amendment. I certainly asked Lori for a lot of it, but I've never had to come to you gentlemen to ask for more money. I will probably break that streak this year. One, I'm getting really tight on my budget, which is fine. It just means if I have a surprise, there's not really anywhere I can rob from anymore to cover the surprise. But in particular, and I hope that I'm not coming back before you to talk about this, but the state has issued an edict, and I'm a huge fan, wink wink, of mandating rules by memo. But the solid waste section, starting fall of this year, has let us know that we are going to have to start monitoring for PFAS. Without a whole discussion on what that is and why it is, it's going to be about another $70,000 in groundwater sampling costs that are currently at about $80,000. So it's going to double it. We're fighting that. I want to fight it just on the basis of I don't like rules by memo. The state has passed a lot of legislation to prevent that, but I guess not enough. But we're trying to work on, maybe a subset of wells, maybe an up gradient and a down gradient and a leachate. So we're hoping to get that down from, 74 wells down to maybe 10. But got to see if the state will go along on that. But I more or less purposely did not put that in my budget because, one, I got the memo after budget time, and two, if we have to pay it, I want to come and have y'all, I wanted to be able to come and say in public setting what this is, why it is. I didn't want to just eat it, and because, like I said, I just have an issue with that. It's just not supposed to happen. And the only reason I've been given we need to know about PFAS, but what we already know about PFAS is they're everywhere. Are landfills big contributors? You know, I don't know. I guess it's worth knowing. But not a lot you can do about it. I don't think we are, I don't think worldwide, we are not near the generators that wastewater treatment plants are. Not busting on wastewater treatment plants, it's just they get a lot more of the material. But the point being that some of my testing locations, if I went all the way back to that first slide and showed you where I test and where the sewer plant effluent is, I mean, it's gonna be hard to get a, you know, what's my PFAS versus what's their PFAS, versus what was in the PFAS before it got here. So if we have to spend that money, I'll be coming to ask for that money so that I can just really vent and gnash teeth about having to do this thing.
Are you talking about phosphorus? What are you?
Oh, no, PFAS, the forever chemicals. You don't know what I'm talking about. It's a class of chemicals. They're called forever chemicals because they don't break down. I mean, they break down extremely slowly.
I said ever chemicals, forever. Yeah.
Forever chemicals, yes,
Yeah.
okay.
And that's a wide,
Well, I think there's 20,000 of them, and they've only studied 6. And the EPA doesn't even have a maximum contaminant level or approved sampling guidelines or approved sample collection guidelines.
but you
So,
still need to know.
yeah, you need to know. The funny thing is, traditionally, I mean, we don't have pumps in all these wells. They have to be hand-baled. And that usually means a Teflon tube. Well, what's Teflon got a lot of? Teflon has PFAS, so we can't use it. Anyway, it's kind of a mess. And like I said, the only thing that they've said is, well, land quality started doing this last year with wastewater treatment plants. And it's like, dude, that's one effluent point. I got 4 landfills with 80 wells. I mean, it's not apples to apples. I mean, so anyway, we're gonna try to at least get it down.
What's the average depth of your monitoring well? I know you got some deep.
Yeah, I mean, we a lot of our wells are nested, and so we'll have a saprolite well, then a bedrock well, and then maybe even a deeper bedrock well. I mean, they run from probably 20 feet to a couple hundred feet. And the big problem, I mean, 30 years ago when some of these wells went in, we didn't know as much as we know now. So one of the potential problems with the wells and why you can't put drinking wells around a landfill is you can't cross your screens across those intervals. If you've got saprolite and bedrock going into the same well, you have a conduit for contamination that may be in the saprolite level, and you're giving it a free pass down into the deep water aquifers, which can, of course, spread further and whatnot. So, we'll see how that goes. I mean, like I said, I just don't like it, so I'm gonna have a bad attitude about it, but if I can't get out of it, I'll come and ask for the money, because I didn't put it in on purpose. What is probably my last slide? What is definitely my last slide? Just some capital projects. There's $1.5 million in capital projects in this proposed budget. The capital projects, none of those are funded from any of those sources you saw earlier. These are funded from retained assets, which is the clever enterprise fund word for fund balance. And so in the years where we have been able to underspend our budget or have more income come in than we anticipated, we have slowly built up a capital fund balance. So what's in this year's budget is back dump. We have made it for 30 years with dump trucks, but we can't keep up with dump trucks anymore. So we're looking to move away from the dump truck and loader situation and move into the excavator and back dump situation.
it like a pan? What's a baggy dump?
No, an articulating dump truck with, you know,
Off-road truck.
look like, yeah, off-road truck, that's probably more commonly what it's called. I was gonna say the Tonka truck, but, but yeah, off-road truck. And damn, are they expensive? I mean, who knew? These things are incredibly expensive. I mean, they're like over twice as much as a dozer. I don't know, I wasn't ready for that. What else we got? A Cinnabogin, y'all ever visited I know I've seen at least 3 of you in there, but the material recovery facility, the building where you go in, the one that burned, where you go in and dump your trash. If you've ever seen that green machine that's in there, we bought the first one and the last one that they sold in the US. They're finally coming back. They're bringing the Tier 4 engine model back to the States. And it couldn't come soon enough for us, because that whole operation is based on that machine, and nobody else makes that machine. If you've ever been on a Lowell multi-handler, your vision's, you know, like this. It doesn't work in a transfer station. So these machines have an elevating cab where you can get up over the boom and everything and see around you. They also pick up a lot of weight versus their footprint, which, because we retrofit that building, you know, it's not the most desirable. It's plenty of size, it just should be oriented 90 degrees for how we're using it now versus how we used to use it. I always put money in there each year for waste and recycling containers. Just, you know, they're getting wore out all the time, so if we need to replace them, it's kind of a placeholder to do that. Projects, still working on the Carson Convenience Center. Still looking to do the recycling processing center rebuild and expansion. Our leachate lagoon turns out has never been cleaned, and we're starting to have some issues with our IUP, industrial user permit, and so probably should do it more than once every 30 years. But it is expensive. I think $80,000 was the quote we got. A lot of that has to do with the fact that leachate can't touch the ground. So as they're dredging this and pulling the solids out, while they're pulling the solids, we can't let any of the liquids get anywhere, and then we got to put all the liquids back. So it's a bit of a process. Just other projects that are alternatively funded. These are from monies we already have from somewhere. Repair of the materials recovery facility, upgrading the water line on Panel Lane, and adding fire hydrants as we move away from cells 1 and 2 where we had fire protection. I want to put fire protection over on Panel Lane so that as we keep moving that way, we have that. Plus, if we ever move into that office over there, we will have water. Plus, when we built the landfill, I might have accidentally put one of the town's water lines under 40 feet of dirt, and they'd like for me to undo that. And the last one is leachate collection system improvements. We're trying to automate that whole system so that it works better for us, better for the sewer plant. It's just, I've had some difficulty getting on the same page with the town. I'm sure it's because I'm not explaining it properly, but hopefully we can get this in and done, and it'll kind of be to the betterment of all. And that's all I got.
Are your trailers on the road yet?
Which?
The new trailers? Not yet.
So, yeah, I don't know what the hell's going on. We got one of the trailers about 2 months ago, and they had sent us the wrong trailer. We ordered the Genesis trailers, and they were basically smooth on the inside and outside. They seem to hold up better. And the one they sent us, of course, wasn't a Genesis. And so we told them to come and get it.
I didn't know, I just.
And 6, I mean, I don't even know when we cut the check for that, but, I mean, you almost got me. We didn't cut a check, because Lori won't cut a check till they're sitting here. But we put in the purchase order to order these things 6 months ago. And they supposedly had them in queue, but they had them coded wrong, and they had them in their system as Genesis models, and they weren't. So I don't know. We may, I mean, obviously, if we don't get them by June 30th, I'll request that Lori do a budget amendment to carry the money for those forward to the new year. But, yeah, I don't know. I just don't know. I mean, you hear about supply chain issues, but, I mean, if you can't build a trailer in 6 months, I mean, how are you staying alive? I mean, you got nothing to sell. It seems like maybe, anyway, I digress.
I'll try to make it, are you guys?
No.
I'll try to make it through this as fast as I can, but I got several questions.
Okay.
And we'll start with the recycling centers.
Yes, sir.
I'm glad to see that you have a sign that you're gonna put at all the recycling centers. But these little hand signs that's scattered all over these recycling centers, is a disgrace.
I
To Macon
couldn't agree
County.
more. I send out a memo about every 2-3 years to do not put up handmade signs. If you need a sign, send us a sign request. We'll decide if we really need it. But please don't put up. I mean, yeah, you're right. It is.
It's very
They're
tacky and,
usually not spelled correctly. I mean,
Yeah.
it's an issue. I get it.
so-
I hate it as much as you do.
And I'm gonna cover the recycling centers, as a whole, and then we'll get into the other. Are you aware of how many counties, surrounding counties, that are closed on Sundays?
I would say probably most of them. I don't know of another county that is open on
So
Sunday.
we talk about, just recently, the landfills over, filling and stuff like that, and it's a known fact that, a lot of these people from these counties are coming in here, getting rid of their trash on Sundays.
Right.
So, so why are we open on Sunday?
Well, to be honest, that decision predates me. But it is my understanding, just from anecdotal conversations I had 20 years ago, and I mean, and sort of some reasoning, it's because of our weekend and summer population. We get, you have somebody come up from Atlanta South, come up on Friday, want to leave on Sunday. They don't want to leave their trash in their can till Tuesday because the bears will get into it. That's as much an explanation as to why they're open on Sunday is just because of all these influx of weekenders that need somewhere to go when they're leaving. And like I said, especially, I mean, I've had this conversation specifically about Highlands many times, because the town of Highlands, in also trying to deal with, the fact that people left Sunday and they got there Tuesday to find, the stuff just spread up beside the mountain. I would prefer we weren't open on Sunday, frankly. I would, if for no other reason than the fact that nobody else is. And so we do have that issue of Sunday infiltration from out of Georgia primarily.
Well, Raven County's open on Sundays from 1 to 5 or something like
Yeah.
that.
Well, most of our influx is hitting either Scaly or Otto. And, I've probably had a conversation with every commissioner we've ever had on this subject. It's difficult, because we have so many residents, at least 6 to 8 months of the year, that have Georgia tags or Florida tags, but are tax-paying citizens in Macon County. And so we can't really, we can't just, when I first started, we had another one of those rogue, well-intentioned rogue convenience center worker that started turning away people with Georgia and Florida tags. And I think the first day they turned away 3, and all 3 of them were tax-paying, property-owning members of Macon County. And I didn't even know this was happening until the next day when I got a really, really angry phone call from my manager at the time. But there are counties around us that have a system that try to do something about this. And I mean, and let me say, waste coming in from out of town, out of county or out of state is, I mean, it's really not even an issue of whether it bothers me or not. By rule, regulatorily speaking, I cannot accept waste into my landfill that wasn't generated in Macon County. And so, I would love for it to not be a thing. There's just not an easy solution. And what some of the counties around us do, well, counties all over the state, frankly, is they'll have a card system or a sticker system. So when you pay, in our case, when you pay your $108, you get a sticker. And when you have that sticker on your car, then that's your free pass through. But in looking at how these have worked other ways, and just kind of reasoning it through, my convenience center workers, God love them, they're cussed on a daily basis. Tell somebody they can't throw a chair in the dumpster, and all of a sudden you spit on their mama. I mean, it's a daily occurrence. So I'm not want to add more potential sources of conflict. So, as soon as Josh puts that sticker on his truck and his wife's running to town and takes the trash and doesn't have the sticker, we got to fight. Or it's in my other car. Whatever. It takes something where you might have some conflict and says, damn it, you're going to have some conflict. The other thing is, and again, I have been in past years put a lot of time and thought in looking at this. The leakage on Sunday, by leakage, I mean the waste coming in. I mean, if you looked at it over a year's time, it might be 10 tons, maybe. 10 tons, that's $660 in lost tipping fee. The card system is $5 or $10 grand annually cost. I don't like it, but I don't want to ask the taxpayers to pay $10,000 a year to fix a $600 or $700 problem. And that's just kind of the way. If we could come up with something else that was effective and easy and is not going to cause my attendants to get into fist fights, I'm all for it. I just think the fix is way outsizes the problem.
The next thing is, which I've witnessed several times, contractors pull into a recycling center and throw in their drywall and all that stuff. I mean, that's a known fact, but.
Yeah.
One day I was on the Highlands Road, throwing some trash away, and this truck pulls in. And, I said, surely to God that guy's not gonna put all that garbage in these dumpsters. So he got out, sure enough, 29 bags of trash. There ought to be a limit at the recycling centers. I went to Otto sometime later. There was a lady pulled in there. She had a pickup truck, 17 bags. I sat there and watched that lady. Big garbage bags. I'm not talking about the little 13-gallon jobs, but there should be a limit on how many bags of trash that, if you have that many, go to the landfill and take care of it.
And especially on the weekends, because, we're open till 2 at the landfill. The centers, half the centers are open till 7, and then 5 or 8 hours on Sunday, and then you gotta get out and about. I mean, we have a lot of trouble just making it through the weekend. So, a lot of times, the workers on the weekend, if somebody brings in a load like that, they'll encourage them, let's get 4 or 5 bags, and how about coming back, because I gotta get through the weekend. Our biggest problem was Highlands Road. We now swapped out 2 of the 40-yarders there for compactors, so I don't have 17 cans that don't fit, trying to get us through a weekend. And basically, it's something we've talked about. It's something that has happened because a convenience center worker decided for it to happen. But we really don't have, now, and we're talking 2 issues here. We're talking people, I mean, there are literally people who don't take their trash till the damn trailer's full. If it takes a week, if it takes 6 months, that's when they're going. And then the other, of course, is commercial businesses, trying to sneak into the centers. Well, we police it as much as we can. Again, I always tell my center workers, do not have a confrontation. I mean, I don't pay you enough to get your ass whipped. But if you are in an if someone is trying to have an altercation with you, just dial 911. We have mediators on staff. Just stay away from the people, let them come and settle it. Told you that for a reason and forgot what it was. But, I mean, jumping ahead to the punchline is, and I've said this, I know Paul's probably heard it 20 times, these convenience center workers are just an enigma. They are the face of the county. There's no other county employee that everybody in the county sees on a weekly basis, except those employees. At the same time, they're all part-time with no benefits, and, they're laborers, they're not working in this building. So it's hard, and I just, my push, what I can do for them is to just try to do everything I can for them to not have issues with customers. And I mean, I am frequently dealing with, the police and issues that happen at a center, or calling people back to explain to them why the attendant told you this or that, and that yes, we do expect you to follow those guidelines, but, for whatever reason, trash is the only utility that the county's into. We don't do water, sewer, or power. We are essential to everybody, but, people sit in line 20 minutes to get a dried out cheeseburger, but ask them to wait 30 seconds to use a center, and they are just all to hell. So.
Last thing on the recycling center, were you able to add hours or days of operation to the recycling center in Scaly Mountain?
I have not added we added hours in Nantahala, but honestly, we have not adjusted the hours in Scaly. And I guess it's something that's on the radar. I don't know, I don't know if y'all had a land rush up there or what, but when we started redoing that center, Scaly was doing about 20 tons. No, I'm sorry. It was terrible how I said that. They were doing about 3 tons a week. I mean, we would pull it once a week, whether it was full or not, just because of mosquitoes and flies. By the time we finished that center and got it back open, they're doing 3 tons almost a day, at least every other day. So I don't know how they tripled, and I know it's not construction, because we also put the compactor in, and you can't squeeze 2x4s and sheetrock into a compactor. So I don't know, but it's on the agenda to basically look at all the centers as far as, what I can see, and I thought it was in my presentation, so I apologize. I don't know what happened to that slide. But we can see at the landfill what the growth in the waste stream is. You have to look at it a little bit different to appreciate what that growth is at a center. We've gone up from 35 to 43,000 tons over a 4-year period. But, what does that mean at Otto? What does that mean at Iola? It's been more years than that since we've taken a hard look. And I guess one thing I'll put a plug in while we're talking about the centers to keep in mind, we've got 2.5 centers updated, working on a third. Hopefully, I didn't know it took 2 and 3 years to get something through DOT, but that's okay. We'll get there. You know, we want to keep that going, and just two of our single busiest center, and then one of our next tier, Iola and Highlands Road. Updating, renovating, making those work better, flow better, means both are gonna have to move to new property. There's nowhere to do it. So hopefully when we get, I mean, you can kind of tell from Scaly and Junaluska, but once we get Carson in, you'll kind of see what the vision is, which is mostly get rid of open tops, put in compactors. What you're really getting rid of is ramps and handrails and all that. But swapping that over and having a bigger space with multiple lanes, I mean, Carson is a nightmare. I can hold 4 cars and then I'm in the road. With this new center, we can hold 12 to 15 cars before we're even out of the gate. And that's with 8 people can be unloading at the same time. So that's where we're trying to get to. Actually already have the containers. Like I said, I didn't know that this was gonna take this long, so.
Okay, I'm done with the recycling center.
Okay.
I guess I'll start with the transfer station in Highlands.
Yes, sir.
Is the contractor that is, that we have to haul from the Highlands Transfer Station, they're paid per trip.
Yes.
Are they paid the same amount whether they have a loaded trailer or no trailer? They're bobtailing or
We
whatever?
don't pay for bobtail.
So if they go to Highlands, they take a trailer, an empty trailer to Highlands, and there are 3 full trailers there at 3 o'clock.
Mm-hmm.
They don't hook up to that trailer, and they come back down the mountain without a trailer with 3 full trailers. They're not paid for that trip?
No, they're not supposed to be.
Okay, so why, I guess my question is why would they leave the Highlands Transfer Station at 2:40 in the afternoon with 3 full trailers?
So I actually have the answer to that. The reason is if they don't leave up there by about 2:30, they can't get to us in time. Okay? So, and part two, so they bring a truck down the mountain, and that's all good and well and great. But if you can't bring it to me, what are you gonna do with it? Well, if her insurance company finds out that she's leaving trash in a trailer hooked to a truck overnight, they're gonna cancel her. So she can't bring it to me, she can't leave it with her, because the state's kinda nuts about leachate, she can't just say don't beside the road. So it has to stay there. Now, the fight against that is to try to schedule when you're going to pick up. You know, make sure you can get that second or third pickup and be back down here by 4 o'clock. When we've had issues with, you know, a trailer out of service, I mean, walking floor trailers are a miracle of modern science, but God almighty, they break, you know, they have a lot of issues. So if we're down and it's an emergency situation, we have let them come in at 4:30, 5 o'clock, and then we'll back that trailer into the recovery building because we're not competing with customers for space, and then have them come pick it up the next morning. But, you know, if they're not gonna get down the mountain until 5:30, I mean, I'll just have a hard time getting somebody to stay there and wait on them. But that is the reason. It's probably something we need a better fix for. Just to be, I mean, when we opened that transfer station 15 odd years ago, you know, we were bringing a couple of loads, or, you know, 4 or 5 loads a week down. You know, now we're bringing at least 12 loads a week. And so, you know, it's hard to make more than 2 runs. Of course, we use 107, we don't use, the gorge. But the waste increase, the volume of increase up there is way overshot what we've seen down here. And there are some extraneous reasons for that we're trying to take care of.
Would it not be beneficial for the county and the taxpayers for when that tractor and trailer gets out to Highway 28 to turn left and go to Homer, Georgia, instead of turning right, and down 107 into Georgia and back into Macon County, filling up the landfill? Because, I mean, you're looking at maybe 20 to 30 minutes longer in a trip.
Mm-hmm.
And once we take it to Homer, Georgia, we pay them for it and say, it's your baby.
Well, frankly, that's one of the reasons I don't do that. I don't go to the landfill in Homer, Georgia. I don't know how it's run. I don't know who else is putting what in there. So I don't want the liability of a future environmental problem coming back on us because we put trash in there. No inspector in North Carolina goes and looks at Homer, Georgia. So I've always had an issue with that. But from a purely price point perspective, it makes some sense, except you have to remember, the money that comes into the Highlands Transfer Station via tipping fees, and we do have the transfer fee. That transfer fee which gets paid straight to the vendor, straight to our hauler. So that facility doesn't have any revenue because the transfer fee is in a check cut to the hauler. The tipping fees are in a check cut to the landfill in Franklin. When that truck comes down the mountain, the tipping fees come with it because the tipping fee is based on filling a hole in Franklin. So anything you do up there is just going to be additional costs. I know it's been a while now, but when we did the landfill expansion back in 18, does that sound right? 17, 18, somewhere in there. And I think I looked at Highlands only, but I know I looked at countywide because the state says you have to, of what's better for us to keep landfilling or transfer out. And just because of the nature of how our budget's set up, and that's been a developing thing over the years as to why it looks how it looks. But as it is, if we were to transfer all the waste to South Carolina, Union, South Carolina, Homer, Georgia, Ball Ground, Georgia, White Oak in Haywood County, wherever, we were looking at about an increased cost of about $1.5 million over current budget. And that's deferring, well, no, I can't defer it. That doesn't explain how I'm going to build a transfer station, how I'm going to all of a sudden put 50 years of financial assurance in the bank because I just decided to close one day. So it's, I often tell people, waste is, there's no right way to do waste. Everybody does something a little different. Even many times I've come before this board and talked about, tipping fees. How do we stack up regionally? How do we stack up? And I mean, there's just no one system. We've got 11 convenience centers. Clay County, little old Clay County, have none. Great old big Henderson County have none. One is you're going to have to come here, and the other one is it's commercial enough. They've got the population density where it's all pickup. But it's just so different. The fact that we still source separate recycling, where a lot of counties have gone to single stream. It would be a little cheaper and easier to go to single stream, but we would lose all that revenue because we can't sell recyclables that are single stream. The people who go and sort them down the line can make the money, but we can't. So that's that's a lot of it. Like I said, it's not. I mean, in all honesty, were it not for for builders in the town of Highlands, I mean, let me say that differently because I don't want it to come across as wrong. I've often said, and I've often had people tell me, my department runs like a business within the county. And that's true, except we're also a service industry. So we don't make good financial decisions all the time. We can't, because there is that service piece, not just the money piece. If we were, if Republic Waste is running Haywood County's landfill, if Republic Waste was running Macon County's landfill, there would be no transfer station in Highlands. There probably wouldn't be non-convenience centers. And you brought me back full circle. When I started out talking about what it meant to be integrated solid waste management, you know, you look at my $66 ton tipping fee. What is it in Homer? 25 or 30?
Yeah, I got a price on it. It's like $40 or something.
Oh, really? I didn't know it had gone up that much.
I've never been.
So anyway, the thing about it is we're not the same thing, okay? Homer is running a landfill. They're not taking scrap tires and paying to have them shipped and ground. They're not taking white goods and what's the other one? They're not taking electronics and paying 15 cents a pound to have them recycled, while I'm getting 3 cents a pound in tip and fee for bringing them in. They don't do any of that. They're just running a landfill. And so if I was just running a landfill, again, it's been a few years, but it's pretty easy to figure. If I was just running a landfill, my tipping fee would be upper 20s, maybe 30 by now. Private landfills don't have to have financial insurance money. They can just sign a bond debt, get somebody to bond them where if something happens, they'll pay. So again, out of my $66, you know, almost, you know, somewhere around half of that has nothing to do with the operation of landfill. It has to do with, we have 3 closed landfills, and it has to do with, we have 30,000 hours a year of recycling centers. And we have, you know, it's just not the same thing. And if we lost that Highlands waste, you know, especially if it's $40, I mean, so.
I don't.
I mean, if it's 20, it doesn't matter. Keeping in mind that if that tonnage is not paying into our system, if it's, what do we do? I said we did 40,000 tons, so let's just lowball it and say 5,000 tons going to Georgia, that's 2,500 loads. 5,000 tons times 6, 56. So that's 300, that's over 300 grand in revenue that we would lose. And our costs may go down a little bit, but I mean, paying somebody $20 versus paying yourself 66, the $20 still costs more. And so if we were to lose that, our costs are gonna be higher, we're not paying ourselves, and then the cost for everybody gonna be higher because we can't divide, we're losing 30, you know, we're losing 6,000 tons of that $66 a ton in our budget. That's, instead of that money coming to Franklin to the landfill, it's going to Georgia to their landfill, so.
Okay. You were talking about the brush and the stumps and everything else.
Uh-huh.
Have you considered a incinerator?
Um,
Since the mulch and everything's becoming such a problem?
I mean, it's not that we haven't had the conversation with engineers and DEQ and stuff. The big problem with incinerators, well, and it wouldn't really be an incinerator. You're talking about what do they call it? You bury the pit, you blow a lot of air in it. Air curtain burner. Look at that. Pulled it out. It would be an air curtain burner is what you're talking about. And basically, the state will do everything in their power to not permit one. I mean, especially, you know, I don't even want to get into hyperbole. The thing is, they're going to say there's other things you can do, and burning it is going to be more harmful to the environment than these other things, whether that's true or not. So that's kind of the issue is the state is just, I mean, even during natural disasters, hurricanes on the coast, landslides up here, they don't want to hear air curtain burn. So for just routine operations, I just don't think there's any way in the world they'd ever permit. I mean, you know, I'm kind of with Josh. I don't really want a monopoly on brush and stuff. It's a loss center for me.
Good job, Chris.
That it?
That's how
I guess that's it.
Anybody else?
Recyclables, up or down?
Damn it, that was on that same slide that disappeared. So,
You ought to know.
I do know.
Okay, tell me.
I just was gonna show you, because if I just tell you, you might not believe me.
I heard they were putting them in landfill. Are they up? Anything?
They're not good. And it, you know, it fluctuates, but it's, you know, that first slide I showed you of our four sources of revenue, well, I mean, state grants is, I can't make that motion. Recycling is becoming so unreliable, I don't, you know, I almost want to just take that money and, hey, if we make it, let's put it in capital for next year. If we don't make it, because it's just too hard to predict. We made a little less than $200,000 2 years ago, over $520,000 last year, and we might hit 250 this year. And the volumes are consistent or growing. It just, you can't look at volumes and revenue and make any kind of prediction.
And the cost of handling, processing.
Yeah. We've never made enough on recycling to pay for the fact that we're recycling. We got close. If we ignore transport from the centers, we got really close last year. But that, you know, we've never been at 50% other than last year. So it is, you know, like I said, we can't always make financial decisions. Sometimes we have to make service decisions.
Good point. Gentlemen?
Thank you, Chris.
Thank you.
Appreciate you.
Thank you, gentlemen. Come see me, call me, anytime you got questions. I obviously like to talk about this shit, I never get to. 22 years of my life, I'd really, my wife's tired of hearing my stories.
On a lighter note, set that in the rec mark. A true service organization.
I'll try to be a little bit briefer. I'm just kidding. I'm just kidding. Actually, I'm not, though, but.
Thank you, Chris.
It's just kind of a guide to go along with the presentation.
How you doing, Sam?
Good. And I'd like to thank you guys first and foremost for all you do. I know that all y'all are tasked with an impossible task this time of year, keeping everybody satisfied. But anyway, just know that doesn't go unnoticed and unappreciated. This is my Macon County Parks and Recreation 2023-2024 budget. Budget breakdown. When I started thinking about what's the easiest way to present, this is kind of what we came up with, is breaking my budget down into four sections. Capital improvements, operating costs, Highlands, and employee costs. My total budget this year is $1,997,181. That's an increase of $53,602, or a 2.8% increase from last year. Breaking these sections in, $550,000 goes to Highlands every year. That's half of their operating budget. that actually line item is not in my budget, so to speak. Whenever you look at the message from Derek, my budget's here, and then the town of Highlands is below it. But I lumped them all together because it's recreation. It's money that we're spending for recreation in Macon County. That's 27% of the operating budget for this year. There's a 0% increase over last year to this year. Employee costs. Employee costs are 44% of my budget. That's equal to $878,961. Obviously, that's the largest chunk of the budget that we use to operate for the year. That covers 11 full-time, 2 part-time maintenance workers, and 20 seasonal pool employees. That's an increase of $3,622 over last year, or 0.07%. That is including the COLA, and you wonder how can we get a 3.5 cost of living and a 1% step and only go up 0.07. We lost an employee last year, and we didn't hire that employee back. We started contracting services out, and that's paying off for us significantly. That's been a money saver for us, and I liking how it's going. Organizational chart. I don't know if any of you guys have saw that before, but that's my department in a nutshell. We've got the Parks and Rec Director, the Assistant Rec Director, then we've got Nantahala Veterans Memorial Park, Community Building, Parker Meadows, and the Greenway. There's a Parks and Recreation Site Supervisor at each one of those places. Community Building has a building attendant under them, and another building attendant that splits time between there and Parker Meadows. Parker Meadows has a site supervisor and a recreation maintenance worker, and the Greenway has a site supervisor and a recreation maintenance worker. Those guys take care of 9 parks in the Franklin and Nantahala area, 151 acres. That's a lot of land, a lot of spaces that folks aren't kind of familiar with. That's the Rec Park, Colasaja Park, the Industrial Park, Parker Meadows, Nantahala Park, the Dog Park. We've also now got a river access point off of Riverside Road and one off of Fulton Road. And of course, the Little Tennessee Greenway, which is, as y'all are aware, a crown jewel for Macon County. Those guys also serve the community. We had 2,789 registered kids in sports this year, 240 senior games and church league adults that are playing in our organized sports only, and that's not counting the public recreational use, which we average anywhere from 100 to 150 people a day walking the Greenway, probably that many or a little bit more people that come into Parker Meadows and use it for things other than organized sports. You can't go to that park without seeing 2 or 3 people walking their dogs, people floating in the river, eating picnics. It's just used all the time. Our pool's in swing now. We're averaging about 200 people a day that are in the pool. We open at 9 o'clock in the morning for lap swim. Then we have a group session from 10 to 12, which are our summer camps. That gets those guys in and out before we open for the public. Then we open from the public from noon until 6, except on Thursdays. Thursdays, the swim team comes in and has their swim meets. Everybody likes to come to our pool, so we have a home swim meet every Thursday night in June, and we host the conference swim meet in July. They don't even ask anymore. They just kind of say, hey, we're coming to Franklin to the Macon County pool, instead of having away games. I think we've won that championship for the last 13 years, and I think a lot of it's home field advantage. Our guys are lucky that they never have to travel. But our pool is very successful. Like I said, we are averaging about 200 people a day that are in there.
How would that do it in the winter if it's enclosed?
The
Game numbers on Highlands or?
I don't know their numbers. I know that the people that use our swimming pool they want to lay out in the sun. They are an outdoor pool community. Now, I'm not talking the swim teams. The swim teams or the lap swimmers would say the exact opposite. They would say, no, we want an indoor pool so we can swim all the time. In Highlands has the best of both worlds. I mean, if you had something that you could open in the summer to where you can allow the sunlight in, where people can still use it as an outdoor pool, but then close it in the wintertime, you don't make very much money on lap swimmers. Obviously, if we had an indoor facility, in my opinion, it would need to be a joint venture between us, the school, and the hospital for rehab and things. I just don't think that we have enough use unless you made it like a small water park. But the majority of the people that use our pool now are either moms with little kids that use our wading pool, or middle school age kids. I mean, we have a ton of those, and in the winter they're going to be in school, so you'd have to have something to cater towards the moms with the little kids.
As big as the community swim team is, do you think they'd get a chance to practice more, like if it was covered?
Sure. During the summer, during their swim team or swim time now, no. I mean, unless we shorten the time for the general public to be able to use it. I mean, our day at the pool is we've got lap swimmers in there at 9 o'clock until 10, then group swim from 10 to 12, then from 12 to 6 we have that's when we're open, the general open hours. Then swim team comes in and they split their team into two, so they practice the younger ones from say 6 to 7:30, and then from 7:30 to 9 are the older ones. So whenever I have to go and do some work, like add chemicals that I need to add, and I can't get to it first thing in the morning, I have to go after 9 o'clock because obviously there's people there. So we cut the lights on almost every night. I mean, it's a full day. We've got 12 hours operation and 12 hours of rest, so to speak, to let the pool kind of calm down and recirculate and stuff. So I don't know that it would increase time unless their season could be longer. Now, I know that the middle school swim team comes in after we close in the summer, like we keep the pool open for them when we close for the season, and it gets cold on them. I mean, obviously it's not heated; it's an outdoor pool. But in the high school, I don't know if they still go to the fitness center or what. But they don't use our pool.
Do you know what it costs Highlands to get that pool covered that way?
It was very expensive.
1.2 million.
Yeah.
I think.
To get that covered?
Yeah, and the operational costs are outrageous also. When you have a building that big, you've got to get rid of the gas, so it's a totally different type setup than what an outdoor pool is. Obviously, you'd want to go to salt water to keep the chlorine gas and stuff because you've got to be able to get that out. But then you've got to heat the air. I know that Murphy came up with, at one time, they put a bubble over their pool, which is an inflatable thing. They had fans in there all the time. You go in and it's loud, but it does encompass the whole pool. But the guy basically looked at me and said, "You don't want to do this. I'm running a $6,000 a month propane bill from being able to heat the air." And so it would be an expense.
I believe at one time the high school went through this conversation, and when you're competing with another business that has an enclosed thing, we didn't win.
No. Well, we we actually had the Recplex at one time had an indoor pool with it, and it fought opposition and failed drastically with the bond referendum. So it's needed. I don't downplay, you know, what we need at all, but our general pool now is used more by citizens that are wanting to come use it as an outdoor swimming park, you know, or a swimming pool. So
And that survey's out now too.
it
so
is.
I guess we'll find out whenever that closes.
Yeah.
If people are interested in an enclosed pool.
Yeah, and I think the numbers will be high. Like I said, I know that you can go, we're having a swim meet right now, and you can't find 5 foot of empty space on that pool deck without a tent being set up. I mean, swim team's huge. It's one of the,
Conference,
oh yeah,
that's one of the biggest things,
Yeah.
with the kids here.
it is. And this time of year, now that Little League's over, it's all the kids that didn't make an all-star team. That's all they've got going on right now until school starts. They run a great program. They've got good coaches, and it's well organized. But it's a great thing for this county, and like I said, it's something to be proud of because they've been so successful in the past. Operating costs are $368,220. That's 19% of my total budget, an increase of 1.37, or $4,980 from last year's budget. That includes things like contracted services, vehicle repairs and maintenance, property and building improvements, custodial, maintenance, operating supplies, electricity and water. That breakdown that I got you guys has everything. I didn't want to put everything onto here. Then capital improvements. Capital improvements, we're asking for $200,000 this year. It's up from $155,000 last year to build pickleball courts. It's an increase of $45,000, 29%, from the 2022 to 2023 budget year. When we got last year's budget, it was really hard to get somebody to build 8 courts for $155,000. I finally found a company out of Atlanta to build them for $150,000, but we were going to we're going to save some money by tying in, by the color was going to be the same as another outfit that they did already, so they were going to give us a discount on the paint to cover it. He had a fencing contract. Since then, fencing prices has went up some, and asphalt prices go up every year. So that's basically the $45,000 increase. Plus, we don't know exactly where it's going to be. That was going to be on the softball field where it's completely flat. There may need to be some grading if so we decide to, what this plan comes in, they may not want to put them there. They may want to do them somewhere else.
What is the time frame? I can't remember what he said.
He's sending me updates occasionally, like once a week on how many surveys he's getting. Actually, right now, not too many people are filling it out. I'm hoping that more folks will actually start going to it and filling it out. I know I'm going to get you some handouts. It's posted at the pool. I'm mentioning to everybody I see, hey, it takes 8 minutes. It's on the county website. If you go to the county website, it's huge. It's right there on the front page. So I would implore all of you guys to ask people, share your opinion. It doesn't take long. You can have it in English and Spanish. We really need that community the Spanish community to fill them out too, because they're a large user of that park.
What would it look like to actually send out that survey to all the landowners, just like you would a tax bill? Is that something that would be?
$18,000. I think that's what the mailing bill is for mail out all the rebounds.
If there was some way to send an email to everybody with it, because they obviously don't want a ton of paper.
Right.
Because because they're doing it all, and it's all
Yeah.
in a digital format right now, so,
Can you
know,
do
that
the
way you
emails?
know that you
Do it.
tried to get everybody.
Yeah, everybody's
to
opinion.
respond. I mean, you did your part, and if people don't wanna participate, then,
Yeah.
you can't make them.
I think anymore, people go by and see those posters and think survey, and it takes forever. But this one literally is like when I filled it out, of course, I was familiar with it anyway, so it only took me about 5, but everybody that's taking it right now is saying it takes about 8 minutes. So it's not very long. I don't know if we have a mass email database through the
We
county.
did some things before on some surveys with broadband and stuff when school was in,
Yeah.
sending it out through the school system. And done some things like that. I don't know,
Yeah.
now school's out, so.
And we have access to some of the leagues all are on mass databases. So we were gonna look at starting to do that. When you fill it out from one phone or one device, it kills it from that device. But you're supposed to fill it out as a family. It asks you how many people you're representing whenever you fill it out. That's one of the questions. So if one person in every household would do it,
Well, it's very
would help
important
us.
because this is the future of recreation.
It
in
is.
Macon County, and it's, so I hope a lot of people will respond to.
Like, talking about future recreation, you think our insurance company would let us stock that pond?
I hope so. The one at Parker Meadows,
Just
we.
see them kids with fishing poles.
I have, we've reached out to the Wildlife Organization, and they're interested in doing a fishing derby with us, where they kind of run it. We allow them the place. I've not heard anything back from the folks we were talking to since we mentioned it, but they thought it was a great idea. I love the idea. As having, even if we can't take the fence, that they wanted the fence down around the pond, and I've not heard back yet about, so that's a no. Yeah, yeah. But regardless, we've got 3 access points that we can open up, and as long as we're there, I feel safe about letting kids be around it and fishing. Heck, if we did it during the summer, I'd even have one or 2 of my lifeguards out there, just to cover our bases, if that suffices for you. But no, I love that idea of having a fishing tournament out there. It's fished all the time now, even though we've got a sign that says no fishing. We run people out of there all the time.
For the survey, I don't know if you answered that already, but what about social media?
We have put it on our page. It's going on the.
It's in a draft
Okay.
It's an oversight for me, so we could do that.
On social media?
It's gonna go to ours. We've asked. I know that the senior games have shared it on theirs, and they're spreading it.
To me, that probably would get more hits than even email, probably.
Probably, yeah. You're probably right. And you can click on the link straight from there, because it's got a link and it's got a QR code. I know that QR codes are a little much for some folks, but if you've got a link there to click on it, so we can have that done tomorrow. Questions? Okay.
Talking about insurance,
Mhm.
had one call, that's right, for it. It's church league and co-ed teams,
Mhm.
what's going on with that now?
Are you talking about by requiring them to have insurance? Kim is here. Everybody that uses the park it's organized in any way now has to have their own insurance policy per our insurance company. That's
Is that the way it's always
Yeah.
been, or is that a recent?
No, it's
recent. I can elaborate on that. So previously, most insurance companies didn't necessarily want the county to have or mandate risk transfer. So with the claims history that the county's had, poor claims history the county's had over the past 5 or 6 years, as much risk as we can transfer to any organized association is our goal. And then on the flip side of that, we can't play favoritism. So any organized league that uses the county facility provides the county with a certificate of insurance naming the county as an additional insured. which then protects the county. Their insurance limits would be exhausted first before the county's insurance responded. So we're transferring the risk over to an organized league. Cost is very minimal. But if we didn't mandate that for every organized association or league that uses the county facilities, then we would not be able to apply for any of them. And then the county's insurance costs would go up because we're taking on the exposure of all the leagues, not just one or two.
So that's gonna strain, I mean,
That's really affected the youth leagues. They've had to have insurance all along, and all we did was add Macon County as a fellow insured to their policy. So that has not affected anything other than
Co-ed softball and church league.
Yeah.
Everybody else, it's always been a thing for them to do.
where those individual teams are having to go buy an insurance policy for them now. It has affected the way that,
It's rated off a number of participants. The most, typically they're $400 or $500, if that, per season, per league.
per league.
For co-ed softball, it would probably be about a $400 or $500 expense annually for them.
yeah. But now, did we not make each team have, from what I understood,
I thought we had to have each team as well.
because the
Yeah.
the church themselves were covering the insurance for their
Some churches.
for their
Some
group.
churches have a policy. Like the church I go to, we have an insurance policy, but I'm not sure that in the fine print that it mentions sports activities.
It should include any, from a church standpoint, religious institution policy should cover anything that they're doing outside, including sporting activities. Our office sends probably 10 a year, 8 a year for churches that we currently insure, and that would be included. Can't speak specifically on yours, but it should be included for church league.
We didn't hear that it was a huge deal for them to add Macon County as an insured. A couple of pastors called saying, "Why are we having to insure Macon County with our policy?" And when you explained, if you're going to play softball on our property, you've kind of got to. But they understood. But I don't think that it added anything to their costs that they were already paying.
Anything else, gentlemen?
Yeah, I had something I was gonna ask him, but now I forgot. Anyway.
Thank the Lord.
Yeah, just wanna-
All right.
If you don't ask, you don't know. I figure you've learned a lot sitting through these budget sessions.
I really have, I was just messing with you.
And then the McGill evaluation is supposed to be in this summer.
Yeah, he says whenever he gets to a certain point with the number of applicants, he's going to start the design phase. He said, "I've already got some notes how he kind of pictures things in the park, but he wants to hear that that's kind of what's looked for." And I've told him the overall design, he needs to keep in mind that it needs to be able to be phased. We need to be able to build chunks of this, not necessarily a thing all at one time. It would be nice in a perfect world to be able to, but I understand how things go, so.
I will say that the town of Highlands and Recreation in Highlands is grateful for the cooperation with the county and the agreement for recreation.
It works out. I mean, we have nothing, I mean, we never have to go up there. They oversee everything. So,
Good deal. Thank you.
thank you.
Thank you, Seth.
Thank you, Nick.
All right, gentlemen, I think we're kind of in agreement, that's all the presentations we'll have. We're running down to the wire, we have a public hearing scheduled, the proposed budget's been presented to the board, public. We have a scheduled public hearing on the budget next Tuesday at 6 o'clock. Just because we're having a public hearing does not mean that we have to have an approved budget, but I would like to see if we don't have an approved budget next Tuesday night, we still got to have the public hearing, right? And then if we change it every year though, after the public hearing, don't have another public hearing, but I always thought that was odd. If we approve the budget sometime between the public hearing and the end of June, think it's only appropriate we do another public hearing, but I've met with the county manager, I've shared some things that I have a little heartburn with. We can do that individually, or we can do it in public. I have a list of things that's in the budget, or we can, however you guys want to proceed. If you're happy with what you've got, or if you want to go into, a vote on this thing, that's an option we have too, either vote for it or vote against it. Voted against quite a few of them. Seems to be routine, but,
Well, Chairman, I'm not prepared to make any comments nor, decisions or anything as far as this budget's concerned. I have, now that we have gone through all the budget sessions and everything, I have a lot to digest
Okay.
and I think a lot more, communications with this board. So that's my stance.
all right, now, we don't want to squeeze, Derek and Lori and Lindsay down to the last minute. They like to have a weekend off, at least one a year.
I would love to have it approved by June 20th, would be my goal, which is a week from Tuesday.
And talking with the Derek the other day, and looking through this budget, it gets, it's just amazing, the amount of work that goes into this. And I do want to compliment, I mean, anything you want to find, it's in there somewhere, it's just finding it, but it's there. And man, the more you get into it, I'm not an accountant, I'm a ditch digger. But we always talk about, from looking back over the years, it's budget, 2022 budget, 2023. That is reflective of the proposed budget. At the end of each year, when you run your final numbers, now in the individual sheets, it has actual budget, it has the proposed versus the actual. But is there any way at the end, when you get this year's numbers done, that we could meet maybe with whomever and just do a little quick assessment of how each department did last year, or is that a process that's been done?
The auditors usually do that.
But you gotta be like Lori to read the audit.
Yeah, we have to wait, even though our year ends on June 30, we work for 3 months past, closing it all out. So if you
Plus
wanted
sales
to
tax.
have like an update from us, that's fine, but it would probably be, late October.
Yeah, I think that'd be good. We've never done it in the past. I mean, we do get the audit, we pay big money for the audit.
Yeah.
But this is a tough document to read. That one is detailed. So let's just keep that in mind. But, okay, Josh, gentlemen, floor is open.
I definitely need a little bit more time to kind of digest some of this. After hearing that, I still got some questions. I'd like to get with Derek a little bit as well, and ask a couple of things. It's not gonna be much, but I just wasn't prepared to vote or anything like that on that tonight, for sure.
Okay.
Don't know, maybe by next Tuesday, maybe yes, but we'll see.
I mean, I don't mind to break the glass. I feel like the big issues, again, are going back to the schools, Chairman. And I briefly asked Commissioner Sherrill last week. I know we have the Highlands Pre-K, the phases with the high school. I mean, those are all issues this board has to address. I feel like the Higdon House, I mean, all that stuff's coming up, and, it's just like at Highlands Pre-K, or we have a one-time contingency in here. I mean, John, is that something that we could use that money on, or is that, I mean, just kind of throwing this stuff out here? I mean, that's a thought that I had, if it's a one-time expense, instead of sticking it back in the budget. I look at our fund balance, and I've griped about it for a period of time, but at the end of the day, if you're really planning a large, financial purchase, I feel like that fund balance is like a savings on a down payment. So although I gripe about it, if we go to pull forward with this high school, it's going to be our best friend. So at the end of the day, I just feel like we need, the schools, in my opinion, are the elephant in the room with this county budget. And I think, I don't mind to discuss them right now. I really didn't come prepared for the schools. I came prepared more for the enterprise and the Parks and Rec, but I think those are the issues we need to address personally.
You talking about school, now you're talking about the school budget here.
Well, maybe, let me say our allocation toward the schools, and maybe our interlocal agreements, what we decide to provide the schools. I think that's probably the biggest factor in this budget. Personally.
You're talking about the high school in particular?
I don't think the high school in particular is going to really affect this budget in particular. I could be wrong in saying that. We've kind of still in the design phase, but I feel like we need to, work on our 5-year plan, our vision. That pre-K it's sitting there, and now's the time to talk about it. Back in September, or October, when it was proposed, mid-budget year, it really wasn't an imminent rush to me. To me, budget work session is the time to address those needs. And if those needs at the Highland School really are needed, and the pre-K really only is a small fraction of that, is that something that we need to address?
And that's what I asked. I had my 4 requests for my constituents in Highlands. One was the Phase 2 and Phase 3. It's projected to be $160,000. I would like to see some money spent out at Zachary Park, restoring that building where where we have some much needed repairs, and that's and then possibly having some dirt moved out there for some practice facilities. I think that's what I'm asking for out at Zachary Park, if it was $100,000, that would be extreme. And then, of course, the chairman and I talked about the soccer field at the Highland School. It's my understanding that the study on this soccer field is not going to be complete till next year. So really to try to throw any numbers out there for that is minimal. So really, I have my constituents in Highlands has given me 3 wishes for this budget cycle, and we're looking at $300,000.
Let me tap into that soccer field, just because I feel like I've had a lot of discussion about it, but what study?
There's a engineer that's doing the geological.
He's got a contract.
And
Been
the school
given
board's
a
aware of
contract.
this?
And so it's supposedly gonna be sometime next spring before that study is complete. And so there's really no need in budgeting anything for that, in my mind. Just know that it's coming up for the future plan, possibly for,
I don't mean to kick this thing around, are they doing like core samples?
They already
It takes a
did.
year
They
to
did
do
it.
core samples?
I think
They
it's
did it.
geologic studies, one
Water
in
movement.
Gilbeck.
yeah.
Okay.
And who wants a 4-year, he'll finish it in April, we're showing it on, we're carrying $880-something.
We've got 873,658 budgeted.
873.
In the proposed 24 budget.
So he finishes his study in April, by the time he gets all the numbers put together, we're gonna be in another budget cycle. So why are we gonna carry $880,000 on?
Well, if you have other capital needs, by
Yeah.
all means, y'all could shift the purpose of that 873,000. And contingency is another good point, we've left y'all some flexibility. We normally only put 100,000 in contingency, there's $533,626, so, there's $433,626. If you've got particular capital needs, that you wanna meet, you've got some flexibility there to say, okay, take it out of contingency and use it for X purpose, so.
And again, that contingency, the increase in contingency is directly tied back, the budget increase. We had 1.2 million, in additional revenue or 1.66 million. 1.7 million in additional revenue come from interest on investments. And that, like we said, that 300,000 of that's why we put it in contingency, but it's marked for one time, because we're not banking on that continued growth in the interest on investment earnings.
In preference to my meeting with Derek on this, when I read the Franklin Press, county looks to expand the budget over $5.5 million. Well, I understand the fiscal end of this thing, the financial end of it, y'all do a great job of handling that, but there's also a political end of this thing. we've never had a $5.5 million budget increase. And what it is, a budget is a reflection of expenditures and revenues. But it's the aesthetics, the optics of the thing. The first time we've ever had a full Republican board in Macon County. It'll also be the first time in history that we've ever had an increase of $5.5 million. We had a $4 million back in 22, but we've never had a $5.5 million budget increase, which to a lot of people is how much money you're spending. It is, but you're offsetting with it with revenue. But it's the optics is the thing that looks a little, I get a lot of questions about. So as a conservative, there's gotta be some way that we can either roll things over next year or use fund balance to pay for some major one-time capital improvements. But to me, politically, that number has got to be decreased. And it's, maybe that's being selfish, but we are a political body.
Well, Paul, you have to consider too, the current revised budget is sitting at 65.4 million, which is more than our 64.5 proposed.
The 23 revised budget.
Yes.
See, we didn't vote on
65.4.
that. We voted on proposed budget
You did.
of 59. That's the politics, that's the political part.
Right.
Now, a lot of that increase could be through increased pass-throughs or,
It's just a variety of budget amendments throughout the year, and by the time we get to year end, it's gonna be much higher than that because of, conservative sales tax budgeting, conservative property tax budgeting, so we have prepared 24, I'm a conservative too, we have prepared it, very conservatively as far as sales tax numbers. We didn't put any growth on sales tax, the property tax are very conservative. The interest earnings are even conservative, because we're probably gonna bring in about 2.2 million this year. I only put in 1.8 for next year. So, we try our best to budget conservatively, but, the numbers are just kind of,
and that's why we need to have that
set up
meeting.
where they are.
When you get that revised budget intact, we need this open discussion about that and maybe some education to us, public, the media, whomever. You all do it every day. We don't.
Yeah.
That's not our forte.
Well, one thing, Chairman, that you made it clear in the beginning of this new board was we were going to adopt a budget and we were going to live inside this budget for 23-24. So that's concerning that we must make this budget right if we're gonna live by the words that you were gonna direct this board.
Well, I was always bothered a little bit by mid-year, someone to come in and all of a sudden they needed another. And it's hard to, I guess, predict for a year what your needs may be, but sometimes the commissioners went looking how to spend money off-season, and I never did. I think we need to project as accurately as we can, conservative as we can, but, and there's some line items in here that I have issues with. We can, if you guys are not ready to, I mean, we can discuss it any time, but we gotta do this pretty quick. We don't wanna,
Yeah.
Do it, let's go.
when you wanna do it.
Well, my deal is, I was gonna do just like you did. I was gonna go through this. I absolutely love the presentation from the sheriff and his team. I think they did, for their first budget, I think they did a great job. And speaking of that, I think it's absolutely critical that we try to get the funds for them to have that body scanner put in the jail over there because of what happened on the Easter weekend with those overdoses. And I think the sheriff said that was $100,000 or something to that tune, and I think that's a no-brainer. I think that should that money should be, that'd be very well spent.
On that, I definitely agree with John on that for sure.
And I like the fact that the sheriff has taken overtime pay and not seeking those additional funds from the taxpayers for those 2 new positions that he needs, and he's basically taking it out of overtime stuff, and he's going to include an officer in Nantahala 24 hours a day, and also in the Highlands 24 hours a day. And I think that's much needed as well.
Well, y'all know where I'm coming from an educational standpoint. I still hope we maintain our focus on our new Franklin High School, along with the Higdon House. I think the vision we have, we don't want to lose it. It's in a phase situation, but we got to be intellectual enough to know that it's definitely a need. You've got 70-year-old buildings and things like that. For Macon County, we're going to have to upgrade our educational system. And a lot of times you do, but it's 8 o'clock, Paul.
Oh, I'm ready to go anytime,
But it's, we're going to have to change, and I talked with Southwestern Workforce Development yesterday about your academics, you have those through the states. It's mandated in your schools. But you make it through your curriculum, through your CTE program to change things. And we're in the process now of generating some ideas on how to go that too will excite students more in their educational arena. And I may have said this to this group here. The information that I'm receiving outside is that we've got a situation where the males from 18 to 24 have dropped out of the workforce. People, that's your workforce and that's your military. Then yesterday, been in a meeting, some of our workforce, and we were working with Evergreen yesterday, and the day was their last day, is that a lot of the people that work at Evergreen now have a digital divide. They can't go out into the job market because the job market has changed so much from a technology standpoint. And one of our members yesterday was sharing a story. His friend had gone to work with the telephone company. When he made that move from Evergreen, there's a process that you go out. And when he went to the telephone company, he found out in a week he's way over his head. So we're in the process now trying to see if you can reinvent that wheel. And speaking with people, we can't lose another group from 18 to 24. We're going to have to go back into our high school curriculum through our career technical education program and recreate a new child, a new person. So you can't, in ninth graders next year, we can't lose that ninth grade when they graduate and become a 18 to 24-hour male dropout person. So I'd still like to keep our focus on that we want to enhance our curriculum via a new high school. We all know that Franklin High School is, and I've said it 100 times, spent 21 years there. I love Franklin High School, the people that's lived its day. And there's some need there that you're not going to find it through renovation. You're going to have to look at this whole thing and recreate the whole brick and mortar along with your curriculum. So I hope we can stay focused on that. That's my spiel for it. I need to go forward with that and stay with it. And I'm always interested on how the money's going to be used in certain phases. I believe I heard the other day where there's money in the fund balance, we could use that money, and you repay yourself when you get a grant or when you get something there. And I thought that was an interesting piece too, that you could move something along that quick. But it's there, we need it, our community needs it, and our young people definitely need it. And we just gotta find some way to get the young people's interest back in this big boy here, which I have a digital divide within myself. But we've got to create something here these young people can get rejuvenated in education. And that's my goal there is that, and you do it through the curriculum. And I'd like to say one other thing, and I'll be quiet, is that with my experience in schools and building schools, being part of the building process, me personally, I think you have to develop your curriculum, what you want first. Then you build your brick and mortar around that curriculum. A lot of times, my experience being, people who have done the brick and mortar first, and you gotta find some way to put your curriculum in there. I think we have an opportunity now to work towards a curriculum, and you design your building around that curriculum. And out of a respect for what a lot of them have been doing, talk with the teachers and coaches, stuff like that, appreciate it. You're out here seeking input, and that's what we're supposed to do. Well, I'm not a builder. I want to be a listener to what other people's needs are. And my respect for people in education is great, because they have to live there every day. I don't. And if there's any way that we can keep the dialogue going between the school leadership, the teachers, and the community and what they know, I think it'd make it a better place for us. And I always say that education is an investment. It's something that's there, and if we invest in it now, you get the product later. And it's an investment, not a cost or expense. Thank you.
Thank you, Gary. Here's a quick, oh,
Okay. No, I was just gonna say, Derek, you and Lori, Mike, Tammy, a lot of work.
Thank you.
Did a great job. And a special thank you to all the, department heads and everyone that came in and presented their office to this board. It was a world of knowledge, and stuff, and, it was greatly appreciated, so.
Yes, sir.
all right, are we going to continue this meeting tonight, or do you want to digest some of this? As John and Danny mentioned, we just got to come together, and I think we need to do it in public, where we stand on a number of issues and expenditures in the proposed budget. But we need to do it pretty quickly. We need to do it way before Lori said. You said when, Lori?
I said I would, June 20th, I would love, which is a week from Tuesday. Our public
That's a
hearing's
week from Tuesday?
Yeah, June 20th would be a week from Tuesday.
Do y'all want to have next Tuesday night? I'm not familiar with the budget. Is it, you got a heavy agenda?
It's not terribly bad.
Yeah.
It's got some good stuff on it.
We have three public, hearings on Tuesday night.
Cryptocurrency,
Greenway ordinance.
camping, and then the budget.
I mean, Chairman, now's a good time as any. If you got anything you wanna, we can compromise on, I mean, I know, not calling you out, but now'd be a good time to talk about some of those
I'm
items.
game. I've got them right
And
now.
I feel like we've got a week, and here we go, we're gonna have the public out there, and now's a great time for the public to hear, to maybe to place some emphasis on the suggestions we make,
Yep.
you know?
And this is, when I went to talk with Derek, I said, Derek, here's where I stand on the budget. This is not, I'm not a dictator. By no means, these are things that I needed clarification on. Number one, the revow, the revenue neutral. The growth factor, we've always used that in previous revals that I've been on, but that increases the property taxes $500,000. Not too bad in the general thing, but it spilled over into the fire departments, and the increase in expenditures to the fire departments is about $200,000 based off just that growth factor. Does that rub anybody? Y'all have any take on that?
Well, revenue neutral, means we come up with the same amount of money that we had in the prior year. And I'll just tell you, I've broken down every one of these, in fire districts, not pertaining to fire departments. I just took their districts and their values and the proposed 27 millage rate. And what I came up with was, there's going to be a $333,000 decrease in tax revenue from Franklin Fire District area, not in the fire department, just in. So as you go through all of that, it comes back down to Highlands. I did Highlands the same way. We're gonna be hit for another $1.226 million more in revenue in the town of Highlands in this revow. So, I mean, and now we're talking about increasing the fees for Highlands people for the landfill transfer station and all this other stuff. I mean, and I've said it before and I'll say it again. We have some of the poorest people in Macon County lives in Highlands, North Carolina. I mean, not everybody up there is rich. So
how do you balance that out?
I have no idea how, but when you do a revow and all of a sudden, I mean, that translates into $15.5 million of tax, ad valorem taxes coming down the mountain. And so how do we, I'm not sure. We keep talking about our people having nowhere to live. Well, this is some of the reasons why. I mean, our people are getting taxed off their land and everything else. I'm not sure what the answer is, but that's just my take on this reval and revenue neutral. Revenue neutral means it's gonna cost Highlands property owners $1.226 million more.
Based off the growth factor.
Well, based off of the reval and the 27 millage rate. Yes.
Now, are you talking about Highlands Fire District or
Well,
Highlands in general?
I just took Highlands District that we got with the fire department and the values, what they were last year, what the values are now.
Mhm.
And then I went to 40 millage rate, which is current, then I went to 27. And when you compute those numbers, that's what you come up with is, I mean, I have them
Because I
just
think
serving memory.
If you look at page, if I could refer you to the budget message, page 8,
Mhm.
that has your, every fire district listed with their current tax rate and the new tax rate. So for Highlands Fire District, it's only increasing by like $30,000 in revenue.
No, I wasn't talking about the fire department. I'm talking about
Highlands Township.
Highlands Township, of what the ad valorem taxes increases are gonna be, based on the current assessment of, or the new rebound, based on 27, it translates into another $1.2 million, in, county tax revenue coming out of Highlands.
What values did you use for Highlands current year? Because like when we prepare, reason I'm just trying to figure out, when we prepare the 40-cent county tax that was in current budget versus the 27-cent for new, we don't single out townships. You know,
Right,
we just
right.
look at the whole county, here's our value, you know, what does it take to be revenue neutral with growth? So
Right.
I'm just trying to figure out what numbers
I
you looked at
understand.
for Highlands specifically.
Let's
But on
see.
just the Highlands Fire District side,
Well, it's
it
just-
only increased $30,000.
Right.
So
The fire department increases $30,000 in revenue, but here's the, in the Highlands, $5,827,000.
okay.
Uh,
Versus the 3.6 billion.
That's correct, and,
Yeah, and I don't know, Highlands Fire District, I don't know enough about this. Does it encompass more than the town limits of Highlands? I'm not
yes,
sure.
yes. So even at this, I mean, this is $1.226,888 in more tax revenue on this revenue neutral. We're at, the tax, ad valorem taxes coming down the mountain is gonna be $15,732,911, where it was $14,506, this current budget cycle. So, I mean, so the revenue neutral there is creating $1.2 million more. It don't settle well for revenue neutral. So,
I mean,
The only
part of
thing
that too is your average home price, I mean, in Highlands has went up in 1 year, it's went up by, I mean, what? It's over $1 million now.
well, I understand, but your local people up there.
Well, I understand that, but that's just how the calculation, that's how like Lori said,
You
we
can
do
only
it
have one tax
countywide.
rate,
We do it, you
countywide.
can only have one tax rate.
I understand, I
It's got
understand
its
that.
pros
It's,
and cons.
It's, but, you know, through these revals and everything, I mean, it just, it forces people to make a tough decision that can't afford to pay for their,
Have you, John, ran that scenario on a home in Highlands, maybe that's not a multi-million-dollar home?
Yeah.
Well, it would be the same like that example I showed.
Well, that's what I'm thinking about. Tommy sat up here and showed us that, you know, homes were, an average home last year was 800, now it's 1.2.
Right.
Those are all more the secondary home market, you know, but, but the people that, you know, that live and work in Highlands and provide the labor up there, their home values most of the time aren't 1.2
Yeah, I
million.
haven't
Because they're
talked
not
to
living
anybody. I just
in, they're
read
not living in
the
an
numbers.
$800,000 home.
Look, if you actually run the numbers and their increase, their adjustment may have been a couple $100,000, but the mill rate went down, I'd be curious to see how it really affects the working man and woman that you're
I
talking
talked
about.
to a few people
And
up
Abby
there, I
could
mean,
pull some of those for Highlands, you know,
Right.
Abby could pull out of the tax system some of the more, you know, lower, priced homes, valued homes, and kind of run it.
Just for an
run a
example,
scenario, you know.
I don't like it either though, John,
Old
I
value,
get
new
it.
value.
751% increase.
if you had a $150,000 home, you wanna do $150,000 or
I'd say go
350,000?
350.
You have a $350,000 home. If that $350,000 home increased by 51%, then your tax increase annually is gonna be $26.95 on that $350,000 house, $26 a year.
right,
If that $350,000 house increased by 48%, you're getting $1.40 tax decrease
right.
next year. So that's how the assessed value went up, but the tax rate balances it. The tax rate, I mean, this budget, the tax rate, you know, when you look at the big picture, at revenue neutral, that's 13-cent decrease in the tax rate. And again, you know, that is the lowest tax rate in the state.
Well.
On average, for the people that you're talking about, what, like home values, what are they, what are the home
I
values?
have no idea, I haven't talked to anybody, I just ran these numbers based on, as a whole, and so, but there again, the reval was done at the absolute peak of real estate in COVID numbers. I mean, it was in the paper the other day that, or maybe it was in Derek's report or something, it's 33% less in home sales or something.
Yeah, your number of sales is down.
It's because
But
of
sales
volume.
prices are staying elevated and continuing to increase in Highlands, so that you have to ask. I don't know how much of it is, but you have to ask how much of that is a supply problem similar to the demand problem. How
Right.
much is it, how much of that is a problem? Is those sales going down because there's not homes out there to buy? Because when you look at that compared to the sales tax is still coming in at record COVID numbers, just like it was then. So people are still traveling here, the travel and tourism numbers. I mean, it's just, and again, the growth in the budget, again, this budget is revenue neutral. And that $5.5 million in growth in the budget is completely reflective of growth in this local economy that has happened. Not growth that's projected to happen, growth that has happened, because we didn't hang our hat on, we're gonna continue growing like this, so we're gonna build this budget up and inflate it on this, on these costs, because we're gonna keep going like this. We said, no, we're not expecting to grow anymore. And then we're gonna build this, we're gonna set parameters on this budget that allow us to continue to navigate regardless of growth that may or may not occur. So this budget is again, as Lori said, this is very conservative budget numbers. You're not gonna get any more conservative revenue numbers to get this $5.5 million budget increase. If anything, additional revenue projections would result in a budget increase, just because we have been so conservative with these revenue projections. I mean, this is as conservative as you can be for sales tax growth, for ad valorem tax growth, as Lori mentioned, the interest on investment growth, which again has been tied all to one-time capital expenditures. That was $1.8 million of that $5.5 million right there, that's allocated completely to capital projects, just because we can't hang operating expenses on that 1.8 million. So you take that out, and now, and look at Jackson County. Jackson County's budget, look at the increase it had. Same thing, they didn't do a reval, but they still had an increase in ad valorem tax base, they still had an increase in sales tax. And that's leading to budget increases not only in Macon County, but across the board. And it's nothing more than purely a reflection of the local economy, especially here in western North Carolina.
But now Jackson County didn't raise their millage rate.
They didn't reval.
No, but they didn't increase their tax rate.
No, they didn't
38.
increase their tax rate, and the budget still increased. That's what I'm saying. So it's, the reval, as we said you mentioned the growth factor. 500,000 of that is attributable to the growth factor. That is, again, in in North Carolina general statutes that tells you how to put together your revenue projections when you do a reval. The growth factor is in that statute. And so that led to 500,000, roughly thereabout, increase, but your growth in the tax base from 22 to 23 is where your $800,000 in ad valorem tax collections, that is the bulk of that increase. And as Abby said, there was 255 homes added on to the tax rolls in that year. There was, you look at, your homes that were selling for 800,000 in the year before, now the average home sales price is $1 million. So in the Highlands area, and the same thing with Franklin, elevating to over the years to 290,000, stabilizing around that point. So the properties are being divided. The improved homes are selling for more money. New homes are being built, and you've got growth in your tax base, and that's where 800,000 of that growth in your tax collections revenue comes from, is natural growth.
Yeah, and these are the revenue growth.
Right.
You're talking about growth in revenue.
Right.
Okay, so let me just try to clear my head on this one. So we had a $59 million budget, 22-23. And the finance guy came in the other day and told us that we were gonna put projected we were gonna put $4.5 million into the fund balance. Is that out of that 59 million?
59 million would be a combination of where we underspent and got revenues over
Okay.
what we projected.
So, in other words.
That's where your fund balance increase would come
Right,
from.
okay. So, in other words, you and Lori and all the people ran this county for $54.5 million.
No,
No.
not necessarily.
Well.
Projections,
but
John.
Projections, right.
No,
No,
you're
above-
missing the projections, what
Above
I'm
and
saying.
beyond is the revenue. We've
Right.
got I only budgeted 110,000 for interest. We're probably gonna get like 2.2 or
Right.
2.3.
Okay.
So boom, there's 2.2
Everything came
million
above their
unexpected. Same thing with sales tax. We
Right.
budgeted, I don't remember the numbers now, but what did it grow? About 1.9?
Oh, yeah, 1.9. And that's with no growth
So
in
that's
24.
this year. We're projecting the end this year at 14.1, which is almost a $2 million growth.
That's what
So
we
between
budgeted for
those
next year.
two revenue sources, there's $4.2 million. And that was again due to conservative budgeting, which in my whole career, almost 30 years now, I've always budgeted conservatively. That's a result of conservative budgeting, that you wind up bringing in more revenue than you projected, which means it rolls into fund balance.
It's conservative budgeting meets substantial revenue growth. Conservative budgeting meets substantial revenue growth. Like we said, you look at the years leading up to the revaluation and your actual sales tax collections, it's growing about 5% on average. After COVID-19, that's went up to 15 to 20% on average. So that is substantial revenue growth. The increase in tax base from 22 to 23, that's substantial, and it's reflected in this budget. But nothing more or nothing less is reflected in this budget. It is what it is.
Gentlemen, we've been here 3.5 hours.
I'm good for whatever,
I'm not tonight.
Let's
Uh,
move.
no.
Let's go.
uh,
Go to the house. My butt says, my butt's all right.
Tuesday night will be our public hearing.
Tuesday, that'll be a
And I
public.
will bring the budget ordinance, not saying you have to or don't have to, but I will have it available. If y'all feel good enough about it, that, you know, somebody wants to make a motion and a second and vote
That's
on
how
it,
it's
so
done.
be it.
That's right.
If not, you know, we'll back up and punt and, you know,
Start over.
adopt
No,
it
not
at,
start
not
over.
start over. We'll
Continue.
adjust and, you know, adopt it at a later date, but.
Thank you for joining us.
Thank you.
So this is a special meeting. Anything, gentlemen?
I'd like to add one more thing. I know you'd mentioned a few things, John, and the things I've heard mentioned. You'd mentioned the improvements at the Zachary Park in Highlands. You had mentioned what else did you mention?
Highlands Pre-K
Hi-
slash.
Well,
The
the
Highlands
Highlands
pre-K.
School expansion.
And Josh mentioned Highlands Pre-K. This budget can do all that. I mean, we can do all that within these funds that we have. All this can be done. Everything that you all want to do can be done. So I would just like to add that. We have the room and the flexibility within this budget, especially with the coming to light about the monitoring at the Highland soccer field. You know, if that's the case and they've got that in that contract for a year, there's $800 and something thousand. You know, the contingency fund, like Josh said, that can give you that for those architect.
On a positive note, the Literacy Council in Highlands just announced that they've been approved for a pre-K, offering a pre-K in Highlands. And I think it's 25 students that they're gonna be able to, and it's gonna be free according to what they, so that's, Highlands is really, I mean, there's a lot of,
Tight-knit, close community.
it is very, and those people work together, not to say that other people don't, but they see a need and they move forward with it, so.
The other thing, sorry,
Yes.
that, before it slipped my mind, the other thing you mentioned was the body scanner
Yes,
at the detention
Yeah.
center.
yes.
We can do that.
Yes,
We can
and
make
I-
that happen. We can
That
make
can
that
happen
happen.
in this
Yes, sir.
budget?
Absolutely. All we can do, if you all say that's a priority, we can go ahead, if we can get a consensus that that's a priority, we can go ahead and move forward, getting that in the budget that's brought to you.
Right.
If there's a consensus on this board, we'll get it in the budget that's brought to you on the 13th.
Don't put it in yet. Don't change your budget until don't spend time. It takes a lot of time to,
Well, we go ahead and get with the sheriff though and get a good quote, or,
Yeah,
you know,
we-
get a good estimate from sheriff and his staff of
What about
what
what,
that would cost.
Amy and Chief Orman talked about the last meeting?
That's gonna be something separate. Now, that's gonna come down
That's
to
the fire
you all
district.
setting the fire
Fire
district.
district tax, yes.
When you look at the fire district, you're gonna have to, the vote on this budget, as it is presented, the vote on these fire districts contains a revenue neutral
Revenue
tax
neutral
rate
for all
across the board for each
districts.
fire district. The Franklin Fire District, should you want to, put the revenue they discussed in there, you will have to, amend that, revenue projection and put a new tax rate in there for the Franklin District and vote on it. So right now, that tax rate for Franklin's revenue neutral, and they're requesting some amount of increase
Some amount of
to
increase.
cover that truck. So if you wanted
What was
to-
their amount, because you had mentioned for what they asked for, you said you came in under that. What were you suggesting?
I'd have to look at my notes from last time. They were asking to go back, I think, to 7 cents, I
Uh-huh.
believe, which I think, I don't have those with me. That was about a 400,000 increase, if I'm not mistaken, on the 7 cents.
But
they
then
were
did you say
saying-
like,
They were only saying they needed about 120,000, so I'll calculate that and have it for
Okay.
Tuesday night though.
okay.
We will have, a lot of go ahead. Lori, I'm
I was
sorry.
just gonna say, I'll just have that for Tuesday night for your information, like, I'll reach out to the town and try to get a specific number of what kind of a dollar increase they need, and then I can calculate the tax rate.
We will have a lot of information coming from fire departments, probably before the end of the day tomorrow, no later than Monday. So
About,
I've asked, for, all the information based on their apparatus, what the years are, what their, projection is for the next 5 years of what their needs are, how much money they have in their fund balance, all kinds of stuff. So it's coming. And so, and I'll share all that with the other board members to, so we can make an informed decision on. Because I know how important their service is, and by all means, we cannot give them what's needed to do their job safely and effectively for the taxpayers of this county.
But that's why I'm bringing that up, because I mean, I get like, you know, conservatively, we don't wanna increase, but when it comes to first responders, we gotta think to ourselves, I mean, are they equipped to do their job? You know what I mean? I went out on a call, you know, with the sheriff's guys, and your lead guy didn't even have a vest. You see what I'm saying? Like, at what point do we, you know, realize the safety that's needed for them to do their job versus us saving money?
And
You know
I
what
can
That's
share
my
a lot
point.
of internal stuff with you,
Okay.
with this, how this, a lot of it works and everything else, so, but,
Done?
I was ready to hit it.
Done? Motion to
we stay
adjourn?
here till midnight if you want, but.
Do we have a
Molar roller?
motion to
Oh,
adjourn?
whoa. Roller roller,
Tuesday night.
Tuesday night, all right.
Do we have a motion to adjourn, gentlemen? Second? I'll second. All in favor? Raise your